Sounds official. All right. Good morning, everyone. Welcome to the December 11th, 2024 meeting of the Oregon Early Learning Council. Delighted to have all of you with us today. And I will ask our administrator, Gabby Hernandez, to call the roll, please.
Yeah, of course. Sue Miller, you are here. Katie Brooks will be joining us late. Peter Buckley.
Here.
Elizabeth Farrar Campbell.
I'm here.
Robin Hill Dunbar.
Here.
Dr. Peg Miller will be joining us late as well. Subin O.
Here.
Ruby Ramirez, and I know she's there
I'm
having
here.
audio issues. Anne Marie Simons.
I'm here.
Thank you.
All right. Thanks, Gabby. I want to just start the meeting today by saying thank you in absentia to Barry Ford, who was on our council, as you know, for the last year. Barry is going to be the new treasurer program officer. So Barry is going to be working with Elizabeth Steiner as the new Oregon treasurer. And I'm sure that there will be an early childhood agenda in the treasurer's office, since we know both Barry and we know former Senator Steiner are very committed to early childhood issues. So while he won't be with us at the council, I'm confident, and I saw him yesterday and reminded him that we'll be looking forward to still working with him, just with a different hat on. So thank you, Barry. So we're going to start today, as you know, from the Agenda Council by looking at the priorities that we've set for the coming year. We've been working on these for a couple of months now and just want to see if there are any refinements, additions to the document that staff sent out. And then I want to spend some time looking at the draft schedule. It's definitely a draft that was also in the packet and get some feedback on that. But let's start, if you would, with looking at the priorities document and see if there are any additions or questions about that document. And I want to thank staff and especially Harriet Dichter, who's, as we know, on the build team, for doing a major rewrite of this after our September council meeting. So Harriet just jumped on, I see, and Harriet, we appreciate your rewriting of our priorities. So any comments on that document?
Robin has
Robin's hand up. Yeah, not sure if you can see that.
Yeah, thanks. Robin?
Well, I appreciate all that's been incorporated after the conversations that we had in our retreat in October and then coming together in November. It's a lot. And, you know, I love the things that are prioritized. It does feel like a lot. And so my brain is trying to wrap my head around, will this then drive the meetings and agendas that we have? How will we feel like we accomplished something at the end of the year with such a big list of priorities? And is there anything else that you is driving our work?
Yeah, great question and a sort of observation, Robin. And really the schedule, the calendar that's included in the packet is intended to be aligned with those priorities. So we believe that the topics that we've identified that we're going to really focus on in the coming year will be reflected in these council meetings. And that's why I definitely want to have some conversation about those topics and how will we decide that we've made a difference or at least been involved in trying to make a difference in those priorities. So it's big. You were right. And the staff feels the same way. So we're not alone in that. Subin.
I told Sue in my check-in that I've had a very, very robust last 2 weeks in my personal life, to say it that way. Um, but I'm looking at this now. One of the things that I recall from our retreat is that there might be there's a difference between what happens in our meetings, our public council meetings, versus kind of smaller groups that form or kind of individuals doing different things in between. So that could be a way to address Robin's question, is that in these topic areas, different council members might have threads of work that are happening there. I wonder if we can kind of get organized around that. So at least visually, I could kind of see, who's touching what.
Yes, Subin, I agree with that. In fact, my thought is that I'd invite you council members to join our agenda planning meetings, based on which topic you might be interested in. And then that would give us the opportunity, Subin, I think, to incorporate what you're talking about as far as what you all are doing, off council time and in your own professional lives. Peter.
Thanks, Sue. So I know you and I talked about this when we spoke last week, but we don't have listed there a priority of adding a hub director as an ex officio member of the council. I know that there might not be consensus on that, but I just wanted to again urge consideration of it, either now or at some point where it seems best. In the work that I do, I'm in constant contact with our hub director, and it just amazes me the impact, the decisions that we make on the work that happens with the hubs is truly significant. And I feel we're missing that communication link from the hubs to the council unless we have a regular presence of a hub director as part of the discussion. So I feel strongly about it. It's kind of like the German model of having a union member on corporate boards. It's the same sort of idea. The people who are doing the work directly, I think, can impact in a very positive way the discussions and decisions that get made. So I just wanted to put that on the record.
Okay, thanks, Peter. Yes, and we can certainly talk about that. Yes, we can talk about that in more detail, but let me see other comments council has. Ruby.
Hi, can you all hear me? Okay,
Yes.
thanks. To piggyback off of what Peter said, I've heard from stakeholders as well as what about having a parent on the council? What about having a provider, in my world, it's a childcare provider, but someone that actually does the direct service work on the ground, in addition to the hub, somebody that actually touches children and families might be beneficial to have on the hub as well for a different perspective. So just want to throw that out there as well.
Okay. We're going to get bigger all the time, maybe. Marie.
This question that's come up around sitting on the council, it really got me thinking a little bit about, what is the communication loop? What is the piece here, Peter, and maybe Ruby as well, that we're trying to solve by having that voice on the council? From my now 1 year into being on this body, it really feels like we sit at a very high level, sort of hearing from multi-agencies, sharing our sentiments, but there's not really I don't mean to, there's just this, we have the rule adoption, but beyond that, there's not much purview for the council. It's really feels like we're bringing people together and convening and collaborating and like nudging. So I'm wondering if there's a feedback loop that's needed, or what the it is, right, that's needed from hub directors or practitioners like, where is the space that's best intersection? Where's the best intersection for them? Because from my view of what our job is as council members, I don't know that it's this table. I mean, not that I don't love to hear from them. I think that's great, but like, where is their input needed to be heard in order to make the kind of movement and change you're talking about? So that's sort of thought lies is there a table where that kind of feedback is really being at the table being set and welcomed and that action's happening from that feedback? I don't know where that table sits, but my thought is that I didn't know, I don't think it's this table, but maybe it is.
All right. Yeah, thanks, Marie. One thought that I've had about this is that as we plan the agendas for the upcoming year, I'm assuming we're going to want to do what we've done last year, which is to have some panels presenting to us on the various topics. And I think perhaps, Marie, part of the answer to what you're raising is that it's in planning those agendas that we can make sure we have some of those voices at the table, whether, excuse me, whether it's hubs or CCR&Rs or CCOs or families, providers. There are lots of constituencies and partners whom we work with and want to work with. So I think we can try to be intentional about who we include in those council agendas is one way, I think, to address it. But, I guess one thought is that because we have talked about this a number of times, as Peter has pointed out, is whether we want to just have a small work group of some council members to meet and really talk this through and see, is the council as an ex officio, participant, would that be the most effective way to get more voices at the table? Or are there other ways to do it? And who are those voices besides hubs? So how would people feel about trying to approach it that way? Ruby.
I think that's a great idea. I think it warrants more conversation. There's several new folks, newish folks on the council, and we'll probably have another new person soon. And I don't think we've clearly identified or articulated sort of what our purview is, right? My sense is that there's a fundamental misunderstanding of what the council does or does not oversee, and it would be worth better articulating that for our multiple stakeholders that do not participate in every early childhood, every advisory group. I think that would be worth doing just to clarify a little bit and maybe articulate better what our mission is. I know that it's by statute, but folks aren't really going to read the legislation, and from my understanding, there's not a whole lot in there, right? That's very descriptive about what the council's role is. And I think we've been working on sort of figuring out what that means for us, but if we can articulate it back out to the community, it would be great.
Okay, thanks, Ruby. You're right, the statute is very broad. Very broad. All right, so I guess hearing no objection, why don't we plan to try to put a work group together? I'm not sure this will be the best month to try to do that. Looking at what's coming up. So maybe in January, we can try to get a group of us together, and I'd certainly be love to have some volunteers for that. So thank you, Peter. And if there are others, just send me an email and we'll put that group together. All right, so we will address that. I know, Ruby, one other thing that you mentioned on the priorities that I thought was really important was the idea of adding under the tracking progress. And tracking progress is sort of the through line, some of it is, of what we're hoping all of the different meetings will include, the presenters will include. And Ruby, do you want to talk a little bit about your thought about workforce?
Yeah, so I know that workforce is a topic, a through line for each piece of this, right? And so if there's a way to track what is being done around workforce in each of the categories, that would be great. I mean, it might be relevant, more directly relevant in some categories than others. But it's a big piece that I hear over and over again from everyone that I talk to, and not just, childcare, but also behavioral health and. So I think it would be worth noting in there as a key measurement as well, right? Like we're building programs, but if we can't staff them, then that's going to be an issue. And so we need to understand how folks are working towards being able to staff the programs that are being funded by DELC and by the state.
Great. I think that's an excellent addition to this list. So let's just add a number 7 that will deal with workforce under tracking progress, if that sounds good to everybody. We know it's foundational to building an early childhood system. You need the staff. All right, thanks, Ruby. Great addition. So council, as you look at the calendar that's in our packets, and we don't have the entire meeting to talk about this, but I wanted to just say a couple of things. First of all, you'll notice that we're basically every other month, we are suggesting that we have a hybrid meeting. So those of us who can get to Salem would be in Salem. Otherwise, there obviously will be a virtual option. And part of the thinking behind that is, as we all know, the legislature will be in session. So we're hoping that we can combine some of our advocacy role with being in Salem for a council meeting. So that's why you'll see alternating months. We are planning to have it be hybrid. Any reactions to that? Sounds good. Do you want more hybrid? Or anything? Yeah.
Just a comment on that, Sue. Is there any way, based on what the agendas are, and our agency director requests of their time, if we can request them to be in person during the in-person meetings? Just for those of us traveling and they're in Salem, it would be lovely if they could maybe in advance carve out a little bit of time to be in person if we're coming all that way to be in person.
Yeah, great idea, Marie. Yes. Yeah, I think if we're there, and I'm guessing during the session, most of them will be in Salem for the day, even if they don't live there. So Gabby, let's be sure to plug that in as we talk with them. Yeah, Robin.
It's only adding one more possible in person than last year. And I just want to say that each time we have been in person, it's been really meaningful and a good use of my time. And so I appreciate the additional option and I'm in support of it.
Great. Thanks, Robin. I appreciate you guys because you're the ones who are driving. Some of us not so much. So, and I appreciate that Liz suggested this when we talked a while ago, and she probably has one of the longest drives. So Liz, thank you. Okay, we will go with that then. I don't think, it sounds as if March 26th is an okay date for everyone, spring break, except for Carrie. Sorry, Carrie. Spring break is all right for people. Is that correct? Okay, we'll stick with that date then. Okay, I think we've got that part of the calendar. So staff has worked with our agency partners as far as this agenda, the sort of the scheduling of these different topics. Of course, it's anyone's guess what will be happening in the legislature on any given council meeting day. So we'll see what topic and which directors are able to be with us versus over at the Capitol. But comments about any of these topics that you all care deeply about or want to be able to help plan the agenda for any of these, we could have 1, or two people maybe on each of them. Ideas about what you really want to see incorporated in these meetings, whether it's universal or for any specific topic. Subin and then Robin.
This is probably true about all the topics, but the education, childcare, and early learning one feels like there's a lot of bullet points. There's 7 bullet points I see wrapped up in that. And I don't know how, even if you had 5 to 10 minutes on each thing, kind of getting through a meeting, I don't know how we kind of, maybe the goal isn't to cover everything, but to focus, right? So that's one comment that I have. So just getting a little bit more detailed when we say childcare, what about childcare do we want to kind of focus on there? If it's so more personally, if it's more related to kind of the education and that sort of thing, I'd be really interested in participating in prepping an agenda for that day.
Okay. Thanks, Subin. And you're absolutely right. I don't think on any one of these topics, probably we can cover everything listed. So we will have to focus. Robin.
I think I'm happy to help with any of the agendas, but the home visiting, behavioral health, and community-based initiatives, family preservation are areas that I would be particularly interested in helping shape the agenda. With the housing, interestingly enough, it's not an area I know as much about. And while we have it in priorities and it has the least amount of bullets, I am, and I guess, I don't know if this is feedback for the priorities and I'm late on that, but I keep thinking about how we talk about co-location when we talk about housing, but the other area that impacts early childhood is unhoused birth to 5. And so I just wonder if that could potentially be a part of our learning when we have housing as a topic, especially when I think about the Momnibus and that first 1,000 days beginning of children's lives. Being unhoused is obviously a high critical impact on the child's development. So I wonder if we could incorporate some learning around that and what the housing department would be focusing on specifically to children that age group in particular.
Okay, great point, Robin. Thank you. Ruby.
Between some of this,
Thanks. I have several comments. I'm definitely interested in participating in the development of the childcare session and then potentially the early learning hub session as well. And I was going to make the same comment as Robin around housing. The other topics feel more meaty in terms of how much we engage with it. So I wonder if there's space for some additional pieces in the housing as FYI for the council. Within childcare, I feel like childcare warrants a very long session. I think we probably all agree that there are multiple pieces. And so immediately what I think about are workforce innovations, things around supply building, and which includes sort of the facilities and employment related daycare. And those are all meaty topics. So I don't know. I think there's value in all of it. And I know that folks, when I hear from folks, these are topics they want to hear about, right? And I know that some of our other council members are also very interested in this specific topic. And maybe some council members are here because of that specific topic. So I think it warrants some thoughtfulness and maybe some more time. I wasn't clear exactly on community-based initiatives. It just gave an example of family preservation, but I'm interested to understand what that means a little bit more, what we're thinking around that. I think we're missing pieces around early literacy, which is going to be a big topic. And I don't know where that would be squeezed in, but there are some pieces there. And then I also feel kind of, I don't want to lose the thread that we've had focusing on equity for such a long time. And so I wonder if that is a topic on its own about what sort of initiatives are out there. Maybe that's part of the community-based initiatives conversation, but I don't want to lose that thread. And I think there's lots of great work happening, and we just haven't really heard about it for a little while. I know that we have a report attached to this agenda about workforce issues, but that is not the final report. So it'd be great to have some kind of presentation at some point. And then the other thing that I was thinking about, and I don't know where we would squeeze that in, but it's always helpful. Folks always want to know what legislative outcomes are and how, I know that Delk won't know how that's going to impact them immediately, but at least if there's some kind of debriefing about what happened, I think it's useful information for folks.
I really appreciate.
Okay, thanks, Ruby. Yes, I agree. And I'm hoping that we'll probably try to build into the different sessions what's going on at the legislative level on the different topics, even though it'll be a moving target to some extent until June. And then certainly at our June meeting, the hubs will be a big topic, but I'm sure we'll be asking our agency director partners for sort of an update or summary of the legislative session impact. Liz.
Yeah, so I would raise my hand for both housing and childcare. And I think one of the things I would like to see where we can is to look at opportunities to invite some of the state agencies that aren't normally at this table that still have a role. So I'm thinking specifically on housing, that maybe it's an opportunity to invite DLCD or maybe some of the county and city planners who are actually making decisions on the ground about decisions about where childcares can be located or not located. I think that's an opportunity for us as conveners to pull in people who we typically are not inviting or don't have a seat at the table, and hopefully raising the profile in their agencies that they need to be paying attention to things like this. And I would say in childcare, one of the voices that isn't often at this table, but I think is really important because of the way our childcare businesses work, is Business Oregon. Because most of our providers are small businesses, and it seems like there's a missing link there because Business Oregon has a stake in helping those entrepreneurs and small business owners. So I think there may be an opportunity when the childcare discussion to have Business Oregon at the table and asking them, beyond the infrastructure dollars that they're sending out, what else are they doing or could they be doing potentially to be helping these small business owners?
Great points, Liz. And you're right, there's certainly other state agencies that have a big impact on trying to put an early learning system together. So great call out. Marie?
I just wanted to raise my hand as well for housing, childcare, and early learning hubs. If we have too many council members who raise their hand, I'm happy to put mine down, but if there's space, that's great. And then the only other thing I wanted to add was, I don't know if any of you all in your daily hats that you wear also serve on a regional solutions team. Speaking to Liz's point about other state agencies, I do know from the Southwest region early learning, regional solutions team, that one of the priorities that has been lifted up in our region is childcare. It's my understanding that there are other regions who are uplifting that as a regional priority. So I think it could be an opportunity, sort of as Liz was saying, to bring in some of these other partners who are lifting childcare up as a priority and sort of expand their learning and understanding and really to see where the right role is for them to plug in. So just a note there.
Awesome. Yeah, thanks, Marie. Regional solutions are just an amazing network in the state. Suben.
I don't know where this fits on the meeting calendar. I'm just going to brain dump and hope that someone smarter than me can figure it out. So in the suspend Every Child Belongs, we have a name now, right? In Every Child Belongs, there are still a fair amount of connecting the dots that I think the council could play a really great role in creating the urgency for the dots to be connected. And so what I'm thinking about is we have the pyramid model. We have tier 1, tier 2, and tier 3. We have mental health consultants and EIECSE up in tier 3, right? We have different things, coaches, LC, those types of things in tier 2. And then we have all the things going on in tier 1 with PD, CCR, and R. The last time we heard about that, right? Things were still being figured out, and we still need other agencies to kind of get involved and play a role in making this vision happen. And it can't just be in Delk's, it can't just be a Delk thing, right? And so that's where I think the Early Learning Council can help. Related to that, I mentioned Elsie. We haven't gotten an update in a while around Elsie, and I would say that one of the things that is I wonder about is one of the things that Elsie is tasked to do is come up with the coaching competencies that are going to change how Oro works. Oro currently works under, hours based professional development hours that people get. And so people don't get credit for coaching, right? It doesn't help them progress in their steps in their professional development. Elsie is supposed to kind of change that. And so that has implications for Oro, that has implications for Spark, which we're about to hear about, that has implications for licensing. So there's a lot of connecting the dots with Every Child Belongs that I think the advisory group can't really handle. Delk can't handle all of those things on their own. And I feel like the Early Learning Council can play a big role. And so that would be a very long meeting. I don't know where that fits and how that works.
Well, it's a really good point. You are so right, Subin. Obviously, there are multiple players in that initiative. And it's going to be the focus of the May meeting with behavioral health. So how we try to pull those together is a really good question. But I think that will be a big part of that agenda planning. Other comments so sign you up for that. Thanks, Subin. I think I already had, but it's nice of you to volunteer. Any other comments? I just want to make a really sort of a strange comment. To really do everything we're talking about, we either need to add another monthly meeting or we need to expand the length of our meetings. Or we just can't cover everything that we want to cover in a meeting and have to figure out what are other venues or other possibilities. But we are a very involved council and a very interested council. So I just want to put that out there that as we plan these agendas, we'll, see what we can include and what we can't. Ruby.
So I am curious what other sort of councils or advisory bodies that function in this similar way, what their schedules look like, how they manage their meetings. I can't remember if it was ODE or some other group that has like a full day meeting or they have multiple meetings. So I'm just curious, what do other models look like? I don't want to volunteer people for more work, but if there's a chance to sort of examine what other groups do and what that looks like for them, and like we can make a decision based on some conversation where we have some examples to go off of, that would be great.
Yeah, thanks, Ruby. And I think Gabby has done a little bit of that research, or Carrie, or maybe your team has.
Yeah, we looked into it. And I think the last time I looked into it was about a year ago and looking at what some of our partner agencies do. And it definitely varies, Ruby. I mean, some folks are meeting quarterly, some folks meet monthly all day. And they meet monthly throughout the year, so they don't have that like summer break. But I'm happy to dig through my stuff and pull that up and then share that with you all just so that everyone can see and pull those examples because we definitely do already have something that I pulled. So I can just double check that and send it out to you all.
Okay. Robin, will you just expand a little bit on what you put in the chat?
Sure. I was just thinking when our list grows large and our time together is minimal, if the more we can do ahead of time, I really appreciated materials going out sooner this time. But if the sooner we got materials, and if you held us accountable to sending questions ahead of time, and some of the digestion of the information is done pre-meeting. So when we get to the meeting, we're jumping in with a lot of work that's already been done to maximize our use of time. But I know that takes a little more timing, prep, and work on our part to do our homework.
Okay. Good point, though. I think we should be looking at a range of alternatives for how to cover the material that we want to. Okay, thanks, Robin. All right, great discussion, council members. Thank you. I'll be working with staff starting tomorrow to see how we're gonna respond to all of your great suggestions, but we appreciate the very great involvement that each of you has in this work. So thank you. All right, we are going to move on, and Beth Green has joined us. Hi, Beth. Thank you for being here. We appreciate it. I think you all know that Beth is at Portland State, and the hat she's wearing today for us is that she's director of COVES, which is fortunately a shortened version of the Center for Coordinating Home Visiting Systems. So this is a very exciting update. And Beth, thank you for all of the materials that you gave us in our packets. Very informative and very exciting. And then we'll certainly invite Peter and Peg when she gets on if they want to add anything as co-chairs of our committee.
Great. Thank you, Sue. I'm happy to be here today and I appreciate the time to provide some updates. Gabby, were you going to share? Let me share my screen.
Yeah, you should be able to share, but let me know if you don't have that feature.
I was noticing when I was preparing for this meeting that this is the, so first let me introduce myself. I am Beth Green. I'm the director of the Center for Coordinating Oregon Home Visiting Systems, or COVES, as we're calling ourselves. I'm at Portland State. And as I was reflecting on this meeting, I realized this is the fourth time that I've had the privilege to be here to update you since just a year ago. And so I'm excited to share some of the progress we've made over the past year. And I'm going to have a few slides to walk through that. Let's see here. Okay. Slideshow. There we go. Okay. So I've already introduced myself. So it was really just a year ago, which seems amazing to me. When the COVES was launched, we were really just an idea a year ago of forming this program neutral backbone to really focus on building that cross-sector system of early childhood home visiting programs, that really, important piece of the early childhood system that provides those critical supports to pregnant people and families at the very earliest stages of their life. And to have the opportunity to work with our partners to really try to facilitate some changes and break down some of those silos and barriers that we know exist and prevent equitable access to those early childhood services. So since then, we've built an amazing team, and I just wanted to make sure to thank them all and put their faces in front of you. They're really responsible for all of the progress that we've made during the past year and that I'm able to report to you today. So they couldn't be here, but here they are in front of you. So thank you to the team. So in terms of some progress updates, so first of all, as I said, there was a bunch of information in your packets, and especially the November communication card, which we shared with you. We send those out monthly to keep everyone updated with what we're doing. Put in a plug for our website. If you'd like to be on the list for the communication cards, you can go to our website and sign up. But just a few things to first talk through in terms of the work that we've been doing that's really guided by the 17 recommendations for systems change that came out of the Home Visiting System Committee, and then a subset of those that were prioritized and approved by this council about a year ago. The first set has to do with investing in relationships. This is really foundational to systems building, as I'm sure all of you can attest. We've really been leaning into the importance of bringing partners together across our agencies. We have 4 different agencies that offer early childhood home visiting programs. And we bring the partners together at the state level, as well as supporting regional level work to build relationships, share information about each other's programs, really get to know each other, and build those partnerships that we know you have to have in order to start to have more challenging and difficult conversations about how to really break down barriers and change practices. So we have 3 advisory groups that we've been working with regularly this year. And we had an amazing home visiting all-day leadership summit in October. We brought everyone together. We had about 50 people or more in the room. Some of you were there. Got to meet some people for the first time face to face. We really dug into sharing information that we've been developing through the COVES team and reflecting with those advisory groups about how they want to work together and what they want to prioritize in the big picture of systems change to really make a difference in the upcoming year. We have emerging work groups focused on specific pieces of that systems work. We have a funding and advocacy partnership that I'm going to talk about some more in a minute. We also have very excited to have the first family level work group, input group. We're calling it input group because it's not clear what their leadership role is yet, but this group is bringing families with lived experience with home visiting programs together from across the state. That group has been meeting to do 2 things. First, to inform the ODHS Families First Prevention Services Plan Amendment, which is the state's plan to potentially broaden the Families First funding stream to provide services and funding for early childhood home visiting and other primary prevention supports. So that work group is getting family voice into that discussion. And we're also working with that group around family leadership recommendations to make sure that we really do have, moving forward, a strong family voice and family leadership in the home visiting systems change work that we're doing at the state level, and also supporting more family voice for early childhood home visiting at the regional level. And then the next other piece is our tribal home visiting peer learning group. This was a group that developed organically. One of our team members, Rebecca, was gathering program information and really doing some really amazing outreach to our tribal home visiting partners. And at their request, started pulling together a peer learning group. They wanted to hear from other tribal home visiting staff and leaders. What were they doing? How could they come together? How could they support each other? So she's been supporting that group as it emerges and has had, I think, 3 meetings to date with that group, which we're really excited about. Our second set of recommendations has to do with funding. We know that systems work and systems change can't be an unfunded mandate. And we know that expanding program services is important, but if you just invest in programs without an adequate infrastructure, that you just keep bumping up against the same problems that our systems have had in the past. Siloed services, difficult access, competition, all the bad things that we're trying to move away from. So we have several things going in terms of funding. First, our funding and advocacy partnership group. This is a broad advocacy group that's being led by the Children's Institute and a contractor, Kara Copeland, who many of you know from the Oregon Association for Leaf Nursery work for years. They are bringing together early childhood advocates, as well as home visiting leaders, pub leaders, the actual hired advocates for our home visiting models to really bring those voices and network together to do advocacy for early childhood home visiting, as opposed to doing advocacy for each individual program. We keep hearing from state representatives and legislators, like they don't get why there's 5 different people in their office advocating for home visiting, when really it could be a shared and collective voice. So that's what we're moving towards with that group. We also have a couple of specific pieces of work. One is a legislative request that Peter is helping us to move forward to do it's a legislative concept at this point, to have a bill that would support a pilot demonstration project that really kind of takes a laser focus on supporting coordinated intake and enrollment through a single point of contact system for home visiting, so that families would really have an easier time getting access to those services. Referral partners would know what number or who to call instead of having to know all about all of the different programs. So there'll be some legislative work that's happening around that bill to do that in an urban location and really focus in on the benefits of having a more coordinated system. The other pieces of advocacy that we're working on have to do with, or fiscal financial pieces have to do with fiscal mapping and some cost analysis. This is coming out of conversations that we had with other states who've been moving forward to better support home visiting systems and programs, and recommended to us and talked about the benefits that they've had or in terms of doing a fiscal map of the home visiting funding streams, which are at this point extremely complicated at the state and regional levels. So there's a myriad of funding streams that come into home visiting, and there's probably some that we are not using as effectively as we should. So a fiscal map really does a comprehensive analysis of how home visiting is funded at the state level, at the local level, with federal funding streams, trying to figure out how to better align and make more effective use of those resources, and identifying resources that may be untapped, as well as identifying what capacities are needed for our program partners to access those funding streams, because that's another problem that we have in the funding system for home visiting, is that not all home visiting programs, especially culturally specific programs and locally based programs, don't have equitable access to those dollars. Okay. And then the second part of the fiscal mapping is to develop cost tools for estimating service delivery costs and systems cost of home visiting, and really try to give a picture of what the true costs are that would be a tool for fiscal planning that could be used moving forward. So we have a request for council approval. Sue, should I move to that now, or should you want to hold that to the end?
Yeah, no, let's do it now.
Okay.
And I don't know if Peter wants to make any comments on this recommendation from his committee.
This is a very important recommendation. This is a foundational step we need to take, in my view. We need to really find out the baseline of where we are with home visiting, with all the different programs around the state, and then that cost modeling to say, what would it take for us to increase participation, making sure we're accessing all resources available, and be able to set specific goals and say, here we are in 2025 at this level, here's what the system looks like, here's how much it's going to cost for us to move to the next level and get access to home visiting for more families. So I'm happy to make an official motion, Sue, if you need a motion. So
I would love that.
I would move that the council approve the request for Cove to seek funding and a contractor for this work in 2025. Beth, correct me if I'm wrong, but I believe Cove does have a small sum of money already in their budget towards this. So Cove would take the responsibility of working with the home visiting committee to find possible sources of funding for this, and to make sure we have the right contractor to do the work.
Is there a second for that motion?
This is Liz. I'll second.
Go ahead.
Okay. Thanks, Liz. All right. Any discussion of this? Any questions about the fiscal mapping that Coves is wanting to move forward with. Yes, Robin.
I just want to say thanks to the council for elevating the issue and need of home visiting coordination in the state of Oregon. I think that the progress that's been made since the Early Learning Council elevated it as a priority it just exploded in terms of the things that we've been wanting to do for 20 years in the state have really been happening due to the priority and Peter and Peg for co-chairing the committee, and all of Coves. Beth and her team have just been, the amount of work that you've done in the last not even 12 months is incredible. And I'm just so happy to see such a needed thing in Oregon really jumping leaps and bounds towards what we wanted to see in the future. So thank you.
Yeah, thanks, Robin. Great comments. All right, any other questions on the motion? If not, those in favor, please raise your hand or say aye. Any opposed? All right, motion carries unanimously. Thank you, Peter, for putting that in front of us. Okay, Beth, we will go back to you.
Thank you. And thank you, Robin. You know, this is a passion project for me, and it's just been a privilege to be able to support this work. So, and thank you, Council, for prioritizing this and approving the motion. Okay, a few more progress updates. So one of the big pieces of work that we've been doing this year is comprehensive landscape of where our regions are in terms of building early childhood home visiting systems leadership. So we've been looking at governance and leadership for early childhood home visiting and how that's happening and how it's structured across the state. We've been looking at coordinated intake and referral systems and where those are happening, where work has started to build, where we have opportunities to strengthen work that's already in progress for coordinated enrollment, as well as for family leadership and where that's happening and how it's happening across the state at the regional level. So we're calling this our opportunity map. It's really a landscape that's going to describe the current state of those three elements of the system and point out clear opportunities for learning from each other and helping regions learn from each other. Again, our mission, our North Star is guiding state support for regional implementation of early childhood home visiting systems. And that document is going to include some pretty specific and actionable recommendations for state guidance and where regional partners would love to have more crisp guidance, some expectations, holding also flexibility for differences in how the regions are approaching this, because there's been some real great work at the regional level across the state in home visiting, whereas other regions have not yet started the work and could benefit from learning from what's happening. So that's coming out in December, and you have a sneak preview document in your packet that outlines like sort of what's going to be in there, because we've been getting a lot of questions. So I'm excited when that comes out. We will be sharing it broadly. And then hopefully using it as a real foundation for the work that we do in our second year. Another piece that we've been doing that gives an example of how we're supporting regions, regional implementation, is that we were approached in September by a group in the metro area, the Perinatal Collaborative, has a long history of meeting together across the region around early childhood home visiting and other perinatal services. They wanted to apply to the Perigee Foundation for one of their major grants, the Building Together grant, which is designed to support building system capacity to provide early childhood and infant mental health programs. And they see home visiting as a key partner in providing those infant mental health, early attachment, prevention and promotion services. So we worked with them to develop a proposal, which we were pleased to learn just a few weeks ago that we were one of 8 in the country that was funded. Most of that money is going directly to our regional partners to do 2 things. Their focus is on working with culturally specific organizations in the region to help them develop this capacity to access additional funding streams, because many of those culturally specific programs don't have the kinds of infrastructure they need to access funding, and also to do professional development and training related to infant mental health services and supports that could be provided by those culturally specific organizations through their home visiting program. So super excited to share that. That was just a great opportunity that came out of the blue. And of course, we said, sure, we'll do that. That's what we're here for.
We're lucky you say yes to everything.
So I know, I'm not sure that's such a great idea all the time, but trying to learn to say no.
Well, and I just want the council to know that I've talked to several legislators in the last couple of months. They always ask for this kind of information that Beth is pulling together. Say, okay, so where are these programs and what are they? And this, I mean, some of them have been asking for this information for a couple of years. So I just want people to understand this is like monumental to be able to have this information, and a huge, huge piece of the value that Beth and her team are providing for building this system. So, and takes a lot of phone calls, I'm sure. And Beth, we only have about 3 minutes left.
Okay.
So sorry, we're going to have to sort of short circuit some.
The rest of this was just updates on other pieces of information that we're pulling together. So if you look in your packet, you'll see that. I invite you to visit our website. I want to leave you with this just because this is always a good reminder for systems work. But if you have 3 minutes, if there's any burning questions, Sue, do you want to?
Yeah, sure. Any questions from council members, or Peter, Peg, any comments from you? Robin.
Only because no one else raised their hand, so I don't want to take time, but do you have any ways that the Early Learning Council can further support this work? When you think of the role of the council and the work that you're doing, can you imagine ways that we can help even more?
Robin, such a great question. I mean, my mind immediately goes to helping to advocate with agency partners and other funders to help us continue to fund the infrastructure, to support the work, as well as really, I think what it's going to take at the regional level, as you well know, as a funder of home visiting systems coordination, is funding to the regions to really support local work to develop the systems. So funding is one thing. And then I think as we have recommendations coming out of our landscape home visiting opportunity map, helping to move action on those recommendations so that it's not just words on a piece of paper, but that folks are really actively working to implement those recommendations. So
thank you.
Okay. Yeah, great question, Robin. And council, you may remember from the calendar that we just looked at for upcoming meetings, we have home visiting slated for February. So we will be hearing from Beth again and her team, but getting updates. And by then we'll have this landscape document and the recommendations. So we'll be able to get really specific about that. All right. Beth, thank you for being here, but also thank you for saying yes and providing the leadership on this, 2.5 years ago?
I said yes in spring of 2023.
Okay.
So, yeah, what is that? Oh, okay, not that very, very long ago, but thank you.
Okay.
All right.
Have a great day.
See you in February.
Yes. Okay. So council, moving on, we are very excited to welcome the Spark team. We've been aware of Spark for a couple of years now, and just haven't heard about Spark for quite a while. So I've been working with Ash and Halep to bring an update to the council today. The way we've sort of organized it is so that Ash and her team will be presenting to us for about 30 minutes. And then we're going to have time after that for Q&A. So if you'll keep track of your questions or comments as we listen to this information, which is going to include some family voice, please keep track of those, and then we'll take them after the presentation. So with that, Ash, I will turn it over to you, and I want to thank Ash and Halep for the many different conversations we've had in the last month planning this. So I appreciate your partnership.
We appreciate being invited. Thank you, Chair Miller and members of the council.
Ash, really quick before you get started, I don't see that the translator is on, but I'm happy to kind of just jump in and translate in Spanish. Council, I know Ash is going to get to this, but their accountability team members are joining. So we're going to have simultaneous a English and a Spanish slide deck. So I do want to just open up the channel for the accountability team members who speak Spanish so that they can jump in there. And I am happy to kind of just translate while I see if the translator ends up joining. So I will go ahead and turn that on. And I'll be the interpreter for now.
And just a heads up, you will see on your screen that you can select either Halabul's screen or Yvette's screen. Yvette is going to be sharing the slides in Spanish so that our Spanish-speaking accountability team members can follow along. Was everybody clear on the language channel? I recommend selecting English now. So in your toolbar, if you click interpretation and then English, you'll be able to hear all of this in English. I have a thumbs up that you're ready. Chair Miller, are you ready? Awesome. All right. So, for the record, my name is Ash Michaels. I'm the Spark Specialist at DELC, and today you'll be hearing from several different presenters that are very close to this work, including Halab Lul, who is our second Spark person here at DELC, Lauren Peterson, you can give a wave, from the Research Institute, also TRI. So I usually say TRI, just want to be clear on I'm talking about the Research Institute. I know how easy it is to just use acronyms. And also members from the accountability team. Not everyone was able to be here, but we have some that were able to join, and they will introduce themselves later in their video recordings that we'll be sharing. And then also a special thank you to Gabby for arranging the Spanish interpretation for our session. Next slide, please. So Halab, Lauren, and I will focus on the first half of the presentation, which will touch on why and how we're redesigning Spark, as well as what will new Spark be. And then the accountability team members will spend the second half explaining why new Spark will be better for children, families, and educators, and obviously communities across Oregon. And I'm sure hearing from them will be the highlight of today's presentation, and then we will wrap up with next steps before transitioning to the Q&A portion of the presentation.
Y luego después de eso
Slide,
vamos a abrirlo para que
So starting
puedan
with the
comunicarse
why, I know we
directamente
covered some of
con
this in the reading
los
materials that we
presentadores
sent,
del,
but real
del
quick, I
council.
just want to say a little bit about me is that I was born and raised in rural Oregon, and a phrase that I heard often growing up was, if it's not broke, don't fix it. Well, nationally, QRISs are not working as originally intended. They need to be fixed. And how do I know they're not working? There's an ever-growing body of research that confirms it. Basically, QRISs all over the US have been assigning points,
QRIS son sistemas de clasificación
to
de
quality
calidad de programas
indicators that are
infantiles.
usually
Ash mencionó que
things that are easier
una
to
nota
measure.
de su
And those things did not always
de
directly
su vida fue
correlate to
que antes habían
positive
dicho que
child
si algo no está
outcomes.
quebrado,
We
no lo
also
tenemos que
know through
arreglar.
research that the strongest predictors of positive child outcomes are when you have those in that box right there, those positive educator or adult to child interactions, those relationships, right? As well as positive educator and family well-being, which of course aligns with Raise Up Oregon goals 2 and 3, because we all really understand the importance of that. Additionally, House Bill 2059, which was passed in 2021,
El estudio de
changed
validación
Spark
de
from
Spark
a
encontró que
quality
los
rating
programas
and
con
improvement
estrellas
system
asignadas
to
tenían
a
interacciones
quality
adulto-niño
recognition
de
and
calidad
improvement system,
significativamente
which
más alta que
also
los programas no
removed in
calificados,
statute
y también
the
el proyecto de ley
requirement for us to have
2059 que fue
ratings.
aprobado en el
And this
2021
really gave us a
conviene a
great
Spark a un
opportunity to
sistema
fix
de
our
reconocimiento y
QRIS
mejora
and
de la
really
calidad,
focus on creating a
elimina el
system that
requisito de
offers ongoing
calificaciones por
support for
niveles y
providers and
reembolsos
educators
y
and
nos ayuda
recognizes
a
their efforts
continuar
and
los
accomplishments. And it
soportes
really
para
allowed us
los
to center around a more
cuidadores de niños.
inclusive definition of quality that is supportive of children of all abilities and identities, right? Thankfully, we had federal preschool development grant funds that really allowed us to design the new Spark system
También
with
teníamos fondos
providers,
federales
educators,
que
and
nos
families.
ayudó a
All the stars aligned, right?
reformar este diseño de
Next slide,
Spark
please.
con educadores y
So I
proveedores y
joined DELF in
familias.
March of 2022 and was tasked with really leading the redesign process. This spectrum
Yo empecé con
by
DELF en el
facilitating
marzo del
power was offered to me
2022
as
y
a
estaba muy
guide. And for
orgullosa
those of you less familiar with the
de tener
spectrum,
la
one
oportunidad
on that side is
de
really the
rediseñar este
one-way
programa con
information
comunidad.
sharing. 2 is the most common form. It's that usually
En
where
el
listening sessions
2019 yo
land.
trabajé con la
And then
comunidad
5
para
on the right-hand
rediseñar
side
este
there
programa
is
y
defer to community. And according to facilitating power, that is to ensure that communities have a direct say over what is needed to survive and thrive. And that, of course, aligns with the DELC's vision, right? That children, families, professionals, and communities are all supported and empowered to thrive. So with this guidance, I created a 4-stage redesign process that really was meant to be driven by the leadership of families and educators, those who are directly impacted by the
yo creé
system.
un proceso que
And we
redefinió las
were
4
able to do
etapas
this
que
by
debían de ser
utilizing a
impulsados por el liderazgo de
participatory
las
action
familias
research
y los
approach,
educadores,
which is in
aquellos
that little
directamente
box right
afectados
there,
por el
that it's
sistema.
one of those
Yo
recommended
creo en un
approaches
sistema
in the
diseñado
defer
por la
to
gente
column.
combinado con
And I really
recursos
do
suficientes,
believe
tiene
that
el
this
mayor
approach
potencial para ser
is one that can help
equitativo
us
y
live our equity
eficaz.
value of sharing power. So I will turn it over to Helen.
Hello, for the record, my name is Hala Wool. Here are the stages of the redesign that was included in your reading materials. And as you can see, families and early learning professionals have leadership roles throughout all 4 stages of the redesign. In the first stage,
Esto se lo
using the
incluimos en
participatory
los
action
materiales al
research
consulado.
approach, leaders went out to their communities, listened to people's stories, analyzed data, and made recommendations. The reading materials include
Si
a
bien puede
summary
ser
of the work
fácil
in
ver
stage
cómo
1,
se
and we
manifiesta
won't
un
be diving
enfoque de
into it during
investigación,
this
acción
presentation,
participativa,
but we
en la
hope you take the
etapa primera
time to dig
miras
into
un
it
poco más de
because that
cerca
work
que
is
puedes
just
ver
as
que las
important.
familias y los profesionales del aprendizaje
In
temprano
stage 2 is
tienen
where
roles
the
de
accountability
liderazgo a
team
lo
was
largo de las
formed.
4
There were
etapas.
those from the 3 listening groups
Primero
of
con
stage
líderes
1
de
that
los equipos de
self-selected to
escucha,
continue
creando el
the work
enfoque de
on
escucha
this
salir
accountability team.
a las comunidades y a escuchar sus historias, también conocido como
The
recopilar
accountability
datos.
team held weekly meetings on Zoom and used the recommendations from the first stage to develop a proposal for the 8 high-level design concepts. The group is made up of providers and parents, and they are a
Este
collaborative
grupo
and diverse
está
group who
hecho
truly care
de
about improving Spark for Oregonians.
proveedores y familias, y el equipo tiene la responsabilidad y se reunió semanalmente para
Good
utilizar
morning.
las
My name is Lauren
recomendaciones de la
Peterson. I'm
primera
with the
etapa
Research Institute
para
at
desarrollar
Western
una
Oregon
propuesta para
University.
los 8 conceptos de diseño del alto
The
nivel.
first
Este
order of
grupo está
business
formado
for
por
our
proveedores,
accountability
padres y
team
son un grupo
uh,
colaborativo y
way
diverso
back
que realmente
over a
se
year
preocupa
ago
por
was
mejorar Spark
to
para los habitantes de Oregon.
design a vision for the new Spark system. And I'd love for you to take a second and read this vision that the accountability team drafted.
Me gustaría darles la
This was the
chance
result
de
of a number
leer
of
esta
meetings
visión del
and
equipo de
really compelling
responsabilidad para Spark.
conversations highlighting what
Esto
they
salió de muchas
felt were the most
conversaciones
compelling
que
elements that needed
tuvieron
to be
el
included
equipo
in
y
Spark.
fue lo que ellos pensaron que era lo más importante para incluir en Spark.
over the course of the meetings last year, and we met pretty
Sobre
much
el
weekly
recurso
for
del
about
último
9
año,
months,
nos reunimos
a
casi
number of
semanal por
principles
varios
and
meses
values
y
emerged.
muchos
And
principales
these were
salieron.
things that we captured as we
Y esto es
listened
lo que nosotros
to
capturamos
the
de los
conversations
principios
that the
rectores sobre
accountability
las
team had.
conversaciones que tuvimos con
And
los
these
del equipo de
6
responsabilidad
principles
para Spark.
emerged in the themes of the conversations over and over again. And pretty
Estas
much
son cosas que
everything that was
salieron
done
de
and all the
varias
work that was done
conversaciones
is grounded in these values. And
y
we're
todo el
really
trabajo.
kind of the guiding light as far as what we wanted and what the accountability team wanted the redesign Spark to be
Y
to
estos
look like and be
principios
grounded
rectores
in.
es realmente lo que el equipo de responsabilidad quería
I'll
que
give you a second. Yeah.
sea la fundación de Spark.
So I wanted to go over, and this is a fairly simple graphic, but this is the framework of what the Spark redesign will look like. As
So,
many of you
este
know, we
es el
currently have a
marco de
portfolio
rediseño
system.
de Spark y
This
cómo
would
se
be a
va a ver.
departure from that. This is very much built on the vision and values, particularly being inclusive, being
Esto está
flexible,
creado de los
highlighting
valores
program strengths,
del equipo
and
de
being really
Spark
driven
y
by programs' own values and their self-identified needs. So
específicamente
this
para los
first phase
programas y lo que
is
ellos
what we
identificaron
call the
era lo que
connection
ellos
phase,
necesitaban.
which is where the program
El primer
finds
consejo
out
es la
about Spark,
conexión, eso es cuando
partners
el
with
programa se entera de
the
Spark
central
y se
coordination
conecta
agency
con
that they may be
personas y
working with,
redes de
also
apoyo.
TRI as needed, and hopefully other programs and providers in their community, and finding out about the opportunities that Spark may offer for
Y
them.
también
The
identificar
second
todas las
phase is the
oportunidades que
planning,
Spark
reflecting
les,
and planning phase.
de
They'll
Spark
have
están
access to a
disponibles
number
para ellos.
of
El segundo concepto son
self-assessment
niveles.
tools, as well as just
La propuesta es
hopefully
que haya
rich
niveles de
conversations
calificación
with
y el objetivo
their
principal del primer nivel
CCR&R
es
partners
apoyar a
or
los
their
programas para que cumplan con
TRI
los
staff
requisitos de
as they
salud
wish,
y seguridad.
to think about
Luego
what's
los
going well in
programas
their
que cumplan
program,
o ya no hayan cumplido los
what they
requisitos de
might want to
salud y
work on, what
seguridad
goals might be
podrán
emerging,
trabajar para
and
mejorar
also
sus
to really
prácticas.
focus on the things that they care most
El
deeply
enfoque
about.
de niveles no calificados brindará
The
a
next
los
phase would
programas el
be going
espacio para
into sort of the
emprender sus
implementing
propios
and
viajes dentro
documenting,
de una comunidad de
where now
apoyo
that they've
sin
chosen
comparar programas
their
según su
goal and the
calificación.
things that they want to work on, they would kind of roll up sleeves and get busy implementing that goal. And in the process, they would be documenting, and there's a whole variety of ways that programs could be invited to do that. What they did and what kind of impact it's having on their program, and how it is benefiting children and families. Families will be involved in this phase as well to support the goals that are being implemented.
Y en esta segunda nivel
The
también
final
será
phase
de apoyo.
is what we call
Perdón,
evaluation
era la
and
tercera
recognition.
fase.
And this is the
Fase
point
3
where
y
they would
4,
be sending
el
some
equipo de
documentation
Spark
to
TRI revisa
TRI.
la
There may
documentación y
be
reconoce los
visits to the
avances y
program. There
logros
may
del
be
programa.
audio recordings, video recordings, Zoom meetings, etc. Any way that the program wants us to know what their story is and what they did, we would be looking that
Se
over
comunicarían
and
con
then
el
providing
programa para saber
recognition
ellos qué quieren que sea
for
la
their goal
historia y
achievement
luego
on a variety of platforms and in a variety of ways to really celebrate and highlight and showcase their accomplishment.
Thank you, Lauren. So these next couple slides outline the potential opportunities and initial
Estas
plans for the
siguientes
redesigned Spark. A summary of the redesign plan was included in the reading material, comparing it to current Spark. Remember that the redesign plan includes designs for high-level concepts, so the details are still being figured out.
nomás estaba mencionando que
With the
los
redesigned
detalles
Spark,
todavía los
there will
están
be
tratando
opportunities for
de
providers to set goals that are
determinar, so
relevant and
todo
meaningful
todavía
to
está
them,
en
such
construcción.
as goals around inclusion or infant-toddler care. In addition, implementing practices in these goal areas can also help to reduce the use of suspension and expulsion. There are many potential connections here, including possible connections to alternate rate methodology. We've also been working with having conversations with those in the program design and administration office to see how other DUC priorities and programs can be paired with a provider's journey in
Las
Spark.
oportunidades para establecer los objetivos que sean relevantes y significados para ellos, como por
With the
ejemplo,
redesigned Spark, there will also be a
en
multitude
la
of
última
resources
página,
that can be utilized throughout a
la
cycle.
implementación de
Some of these
prácticas en esas
resources
áreas
already
de objetivos
exist
también pueden
and
reducir el
will need
uso
to be
de suspensión
modified.
y
Others
expulsión.
TRI will be
Aquí
working to
también
create,
existen conexiones
possibly
potenciales
in
con la
collaboration with
metodología
ELSI.
de tarifas alternativas. Hemos estado en conversaciones con la gente de PDAO. Y aquí
Awesome. So,
en esta
anything
página son
new,
las
it's
cosas que
common to
ahorita
ask,
existen,
how will
pero
this
que todavía
work,
van a cambiar y
right?
están
Who's going to be doing
trabajando con
what?
TRI y con LC.
So, the Spark team at TRI will really be in charge of
So,
implementing
esta
and
página es
managing
sobre el
new
personal
Spark.
de apoyos y redes.
Plus, since while we believe that the cycle and the future online platform will be easy to navigate, we believe that many programs would be able to complete a cycle on their own using the resources provided. However, some programs will want to work directly with a person or to be with a group of their peers going through the process for at least their first cycle. So this will be possible with the Spark team at TRI, as well as with the help of CCR and our staff. So right now, TA staff that help programs in Spark at the CCR and ours spend a lot of time really helping them complete that giant portfolio that many of you have heard of. And this shift will really allow them to focus their time on walking alongside programs and helping them pursue goals and access resources to meet the needs and priorities of the children and families in their communities. That's really the goal, is to help them provide that responsive care, which is also known as high quality care. Next slide, please. So all of those slides really do summarize the accountability team's design for New Spark, offers a peek at some of the upcoming resources, touches on some of the logistics,
esa
but I'd
información
also like to take a moment to acknowledge that what the accountability team has created really does offer some amazing equity improvements. They found a way where New
resume lo
Spark
que hemos
could
hecho
be a
ahorita con el
flexible
programa de
and
Spark,
supportive
pero
QRIS
también
that
quiero
promotes educator and family
llamar
well-being by really
atención
facilitating the
el
creation of these
equipo
ECE settings that align
de
with family
responsabilidad
needs,
y por todo el
values,
trabajo que
and
ellos han hecho.
cultures.
We've also partnered with Delk's Tribal Affairs Office to request input or partnership from the 9 federally recognized
También
tribes.
hemos
We sent
trabajado
out Dear
con
Tribal Leader letters with the
la
redesign plan
consulta
and have
tribal
so far connected with Klamath tribes, Confederate
y
tribes
desde
of
entonces
Umatilla
nos hemos
Reservation, and Cow
conectado
Creek
con
Band of Umpqua Tribe of
la tribus
Indians.
de Klamath
We
y
received
las
some
tribus
feedback on the
confederadas de
plan
la
and
Reserva de
also
Umatilla
interest
y la
in
banda Cow Creek
to
de los
partner for
indios
the
de
rest of the
Umpqua.
redesign.
Estamos muy emocionados por las mejoras en
The
equidad.
redesign required the work of many different partners, so we want
También
to
les
take a
queremos
moment
dar
to
gracias a
thank
todo el
the
trabajo
accountability
que
team, listening teams, all the families,
todo el
the
trabajo que
representatives
todos
that we
nuestros
connected with and the different tribes, community wealth
partners
partners, and of
y
course TRI.
los equipos que nos ayudaron con todo lo que hemos hecho sobre hoy.
So now we will shift our focus to hearing from the accountability team members. We will play a
Ahora
recording
queremos
where 4 different
cambiar
members answer how the redesigned Spark will benefit providers, families, and of course children, the questions that are on the
Ahora nos
screen,
vamos a mover a la
as well as one
discusión
person's
sobre los
reflections on the
resultados.
redesign
Tenemos un
process.
video que vamos a
The last
compartir
person,
con
Claudia,
los
will be speaking in
videos
Spanish. So we hope that
de
you all are
contabilidad
in the English
y
channel.
les queremos
And I'll be
avisar
sure
que
to pause the
Claudia va a
video
hablar en
to give
español, so
whoever is
queremos
interpreting
asegurarnos
a
que
chance
todos
to switch
están
channels.
en inglés. Okay. Y va a pausar para que me mueva yo para el otro.
So my name is
foto.
Fernanda Lucas. I'm the parent and I'm a provider. I have experience as a teacher for more than 10 years. And I wanted to be part of this redesign team because I felt that there's so much growth that we can do in our programs, and how Spark is a very good tool that can help our programs to become a very good quality program for children in Oregon. And I feel that the goal of Spark, since I was involved making my own portfolio and trying to qualify for Spark, was to improve the quality in the program for all the children to have access to a quality program. Because I feel like there's so many programs that open and that they want to learn and to grow, but they don't have the resources or the support that they need. And I feel that Spark is that tool that they want each program in a unique way to set up their own goals to improve the quality for those children. The children are at the heart of Spark and the whole redesign, because all the things that we have been working and talking and improving and trying to set up, like how we're going to make this accessible, how we're going to make more providers get involved in the process to be able to achieve these goals and to have the resources and support that they need, is thinking about the children. And having these programs and making the providers know how to make these little steps, or where they have a space for improving in their environment, in their materials, in their professional development, in their engagement with the families, and how to connect with each of the child and the uniqueness and all the milestones that they need to go, and having these resources and having access to being able to, in their own pace and in their own capacity, to be involved in this, it benefits the children. If we have strong programs, if we have providers that have the resources that they need, if we have families that have access to these quality programs, the children are going to thrive in these programs. And Spark is going to be that tool that is going to help access to this quality and have access to this connection to how we can make this happen. And we all here have been always having an account that this is for the children and for their families to feel the support. And when we can give the support to them, we are also giving the support for providers and the schools and the programs to have this capacity to make that happen.
Okay. So my name is Sage. I'm the parent of a child in Head Start. And at the beginning of this project, I knew nothing about Spark. Throughout this project, I and group members got to hear from many different parents about their experience with childcare. A main message I heard from parents was that they felt they had no real choice in where their child attended childcare. Then, even if they were lucky enough to get a spot in a childcare, often it would feel like a family's cultural or social background was not respected, and children with disabilities were not meaningfully included. And because families often have no backup option, they just had to make the best of the situation and hope their child will be okay. We recognize that this is a very disempowering place for families to be at. The redesign of Spark will help families by encouraging more providers to participate in Spark, because the program will be more accessible to the providers. More participation in Spark by providers will allow parents to use Spark as a tool to make meaningful comparisons between programs. Currently, there is not enough participation to make the tool very meaningful, particularly in rural counties. For example, in the county that I live in, the only Spark certified programs are Head Starts, and the private preschools in the area have chosen not to participate. There's nothing for me to compare to on the Spark site, and no real information shown on how to contact these other preschools for enrollment. They may be great childcares, but because they're not participating in Spark, there's no way for me to know. It is important to me that the information about the quality of childcare is shared equitably among all parents. Because as it is now, wait lists are long, and parents who are well connected and have other demographic statuses that provide them privilege are able to share information about the quality of childcare amongst their friends, who are often of the similar statuses of privilege. That fills the childcares with those people in those situations, and other parents are often never able to get a chance at admission to these childcares. Greater participation in Spark will provide a bit more and a step towards equity of information about quality programs to all families, regardless of their demographics or social connections. The Spark redesign process will also benefit parents by providing a more open-ended format for the presentation of Spark materials to parents. It will improve communication between parents shopping for childcare and childcares by providing childcare providers the ability to be honest in presenting their unique strengths as a childcare, rather than trying to meet the requirements of an agency's determination of quality. That way, a family will have greater ability to determine what is the unique quality a childcare has, and if that best matches the ideas of what they feel would be a quality of childcare for their family.
Yeah. My name is Hadiatu L. Johnson. I am a provider. And for the Spark redesigning, I think it's very important. And with all of the conversations that we've had, one of the main things that really resonates with me is the idea that there's going to be more languages, for people to be able to access back. Because before, the reason why people just stop at level 3, I have never participated in Spark. But the reason why people just stop at level 3 is because they did not have access to the program based off on languages. And so that was one of the barriers that people had. And this process that we're going through, we have thought it fit that the introduction of more languages would help more people to be part of this process. Also, another thing that I would like to say is what resonates as well with me is the idea that we're talking about not even thinking about just licensing as the criteria for you to be part of Spark. Now it's been opened for everyone to have an access as a provider based off on your own markers, based off on the things that you are great at, which would be the things that would be highlighted for you to be a better provider whilst growing with the money or the funds that is available for you, but at the same time growing in your own space and at your own time. You're not, given so much work to do without knowing what you're doing. But because you're growing based off on who you are as an individual and as a provider, it would help you become more a professional for this process. And so I would say the designing of Spark would create a foundation for excellent providers whilst retaining their individuality and achieve long-term successes. So, thank you.
Thank you, Hattie.
Buenos días, Claudia Morales y soy proveedora certificada de cuidado infantil en Beaverton. Ya alguien les habló del proceso colaborativo de una diversidad de participantes.
Pause for a second. Was there a question about interpretation?
So it looks like we don't have it set up to do the consecutive interpretation for Claudia right now. Gabby, would you be able to interpret after Claudia finishes?
I will try my best. I'm trying to take notes on the side, so it might not be word for word, but
Yvette
yes.
is present. Yvette, would you be willing and able?
Hi, I will do my best to capture what Claudia is saying.
Perfect. All right. Thank you so much.
Antes en el rediseño de Spark, yo les hablaré de cómo este rediseño, el proceso ayudará a que haya más participación de proveedoras en el cuidado infantil. Uno de los objetivos de Spark es que haya más programas educativos participando, pero anteriormente el proceso en la colaboración del portafolio y algunos estándares a cumplir eran muy complejos de elaborar y lo que desanimaba a las proveedoras a terminar el proceso. Este rediseño de Spark ofrece un proceso flexible y con un marco de 2 caminos. Y esta flexibilidad hace que participar sea más accesible y atractivo para los proveedores de cuidado infantil. La participación de la comunidad ha hecho que el rediseño sea más motivador, lo cual nos llevará a no solo que más proveedores participen de Spark, también programas infantiles que se desarrollan en los distritos y así crear más programas de alta calidad, que es la meta de Spark.
I'm unavailable to.
I was like, I can do my best. Hang on, I can okay. Sorry. Okay, so Claudia just shared that she is a childcare provider in Beaverton. And she just mentioned how someone already walked through the Spark process. She wanted to talk about how this redesign and the process will really help increase participation from providers. And Spark gives the opportunity to have the opportunity to participate just because of its flexibility. It really offers lots of flexible opportunities and gives providers more accessibility to be able to participate and really helps make the design more flexible. And this, in the end, will really help create more high quality programs, which ultimately is the goal of Spark. In summary, she did add a little bit more, but thank you for bearing with me while I tried to summarize that.
Thank you, Gabby. We appreciate it.
So my name is Fernanda Lucas.
Sorry. So next steps for the redesign include building out the details of those approved high-level design concepts. This will include building a DELC support group for DELC staff to work in collaboration with the accountability team, as well as continuing to work with the accountability team and TRI, continuing with tribal consultation, utilizing the feedback that we received from DELC leadership to build out those concepts, and promoting and piloting the quality improvement cycle. The QI cycle aligns with the proposed redesign for Spark, and so we are promoting that and piloting that. This brings us to the Q&A portion. We would be happy to respond to any questions you have about the redesign. We've also invited accountability team members who can help respond to any questions as well.
All right. Thank you, Ash, Haleb, and the accountability team members who provided input. Very helpful. It always helps to hear from people who are actually, on the ground. And Lauren, thank you for
Muchas
your
gracias por
comments
todos,
as well, and your
por la
partnership
presentación y sus
in
comentarios.
this.
Muchísimas gracias por su
Okay, council,
participación
so we
en,
now have time for questions
en el
and
rediseño de Spark.
comments.
Ahora
Subban.
tenemos tiempo para
Hi,
preguntas
everybody.
y comentarios.
I have so many comments and questions, and so I
Tengo
wonder if
muchos
I should just
comentarios y
let
preguntas.
them all out, and
So
then you can
nomás no
pick and
sé si debería
choose
de
what
saber
you
si
want to
los diría a
respond
todos y luego así
to.
podemos luego decidir lo que queremos responder.
Good idea.
I really appreciate how much engagement is happening and how many voices are contributing to this. And that
Realmente
feels like a
aprecio
system I would
cuánto
want to be a part of. That feels like
compromiso
something
han
that will result
hecho en
in something
involucrar
that
tanta
feels
participación de
good to a lot
proveedores
of people, to a wide swath,
y
like
en
something is
crear
happening
algo,
with them as opposed to them.
algo
And so I
con
see those
los
values,
proveedores
I
y la
see the
gente que va,
heart and all
donde
that goes
estas
into
cosas los
that,
van a
and
afectar.
recognize that
Y
when,
quiero
in order to do that, it takes a lot more
recognizar que
time. It takes
sé que
more
para hacer todo
thoughtfulness
eso
and
dura
planning, and
más tiempo planeando
you have to fight that urgency thing,
y no es
and
algo que pasa
so I
realmente
recognize
rápido.
all of
So
that.
quiero nomás de nuevo decir
And
gracias
so,
por
okay,
todo el
so that's
tiempo que
one
han
comment I
dedicado para
wanted
todo
to
esto.
start with that.
Ese es un comentario con
One
el que quería
thing that I
empezar.
was going through the supplemental materials, and it was really helpful to see
Estaba
the slides
revisando
of like
la
current
información
Spark versus
suplemental que
proposed
nos
design and things like that.
pasó
This may not have shown up
Ash
in
y
your
Haleb.
findings and your themes, but the way I kind of read those slides is here's a problem of practice with Spark, and here's like, some input that's leading to some new ideas, right? One of the problems of practice that I've heard out in the field, and I'm curious if this has come up, is an issue of it not being seamless, right? And what I mean by that is there's Spark,
Está
there's
mencionando
licensing,
que
there's
sobre
Oro,
la
there's
información
TSPC if you're in
adicional
a
que
school
nosotros le
district.
dimos
There's all these different things that are
a los
asking for
participantes.
information
Hay
around
algo donde
professional development, around
significa
aspects of your program
donde
and what you're trying to
anotamos
do.
problemas
If
de
you're Head
práctica
Start, you have a
y
whole
es
other
algo
system
que
that
no
you
es
need to
muy
deal
fluido.
with. And people are saying like, how can this just be one thing, right? Where
Y es muy
I have to
difícil de
report on
identificar
so many
que es muy
things.
difícil decir que
Can
esto
I just
solamente es
give you
una
what I've
cosa cuando
given my
tengo que
Head Start
reportar
people? Can I just give you what I gave my
varias
licensing?
cosas.
So
Te puedo
that's
mejor
another
nomás
problem
dar
of
lo que me
practice that I
están
just want to put
pidiendo
out there. And
los
I'm
del
sure a
gobierno
lot of
federal, los de
providers
Head
would be
Start. Y
really
digo,
excited to hear if that was resolved in some way.
sé
The
que de
other
seguro
thing that I
ha
just
notado
kind of
que
want
hay
to ask,
proveedores que
I didn't go to the Spark conferences and stuff, or I'm sorry, QRIS conferences. I went more to like the registry type of stuff when I was working for OCCD. But I know that, as a
Si bien está
national
notando que
movement,
él no ha ido a las
QRIS is
conferencias de
thought of
Spark,
as like a market-based
pero él
intervention.
sabe
It's
que
thought of as,
QRIS
you give these ratings. It
es un
works like
programa
Yelp, where,
donde
you see a
les
3-star,
das
a
estrellas
5-star, it
como a los
means something
programas
to
y
a
trabaja
family. They're
como
able to
la
choose.
aplicación de Yelp,
And that's
donde luego las
what
familias
you
tienen el
started the
poder de
presentation
decidir
around that.
y
Around
selectar
there's not really any
lo que ellos
significant,
quieren.
meaningful difference between 3, 4, and 5 stars.
Pero notaron en la
And
presentación que
the
no hay
ideas I'm
gran
hearing
diferencia
from you in
sobre
the
el
redesign, like I
rango
said,
de 3,
very
4 o 5
enthusiastic, and I'm
estrellas.
very cool with it. But it seems like we're moving away from what the national discourse is saying around what QRIS needs to be, and we're Oregonianizing it,
Sí,
right? And kind of
está notando
creating
que
our
se dice
own
que de
ideas
lo
of what
nacional
needs
lo
to
que
be with Spark.
QRIS,
I'd love to hear your thoughts if
quiere
you
hacer,
feel like that's the
si lo
case,
estamos
or
haciendo
if this
más,
does kind of plug into like a national thing. Have you been
más
recognized
directamente
in
a
some way?
Oregon.
Are
So
people listening to
su
what Oregon's
pregunta
doing?
es
So those were my big questions, and respond to
al
what you can.
nivel nacional. ¿Qué está
Wonderful.
pasando?
Thank
La
you,
gente está
Councilmember
mirando lo que
Stewart.
Oregon está haciendo.
So first off, around the problem of practice and the,
So, sobre los
can this
problemas
just
de
be one
práctica,
thing?
y si eso solamente puede ser
That's actually
una
a
cosa,
big part of what
eso es una gran
people
parte
on the accountability team
de
had discussed,
lo que el
including we
equipo
had
dispuso.
Robert, who's a Head Start
En
director,
casualidad,
talk
Robert, que
about
es un
how
director
if
de
it's
Head Start,
about
habló
goals, can we
sobre
just
si es
share with
sobre
you the goals
metas.
we've already set for Head Start?
Podemos
Absolutely,
compartir contigo las metas que
absolutely.
ya
When we're
seleccionamos para
talking
Head Start.
about Baby
Sí.
Promise,
O si estamos
we work
hablando
with
sobre Baby
Mady
Promise.
here at Dell,
Hemos
and
trabajado
she
con Mady, que
has
trabaja aquí en el
visions around
Departamento de Educación
goal setting,
de Aprendimiento
already
Temprano,
having some sort of grant
donde ella
expectation
también tiene metas
around, I
sobre
think
las
she's
de
calling it a
aplicación
growth and
de
development plan. So
y un
yes, they could
plan
submit that
de
in here. Just like with Focused Childcare Networks,
developmentación
they're
y
already setting an
expandir.
annual goal. They could
Ellos
set
ya
their
tienen
goal within
metas.
here, and it's not about more work. It's about getting you connected to more support, more
No es
resources, and
sobre
making your
creando
lives
más
easier,
trabajo, es
not
sobre
adding more burden. And this was big to the
conectando las
accountability team,
metas
right? They're like,
y
we don't need more
haciéndolo
burden.
todo uno porque no les
People are
queremos
already
dar
doing so
más
much.
trabajo
So
a los
yes,
proveedores.
to
Queremos
that.
hacer el proceso que sea
And
más
then
fácil.
your question around the national
Y la
discourse.
pregunta sobre
So there
su
is,
pregunta a la
certainly
nivel nacional.
different political
Sí,
climates
es muy
in
diferente el
each
clima
state,
political
right? And
ahorita
so what they're
y
able to
esos
focus
climas
on
diferentes son,
is
varían
different.
por de estado a estado.
There was even at the last Build conference, one person sharing how they can't even say the words equity. So what we did
Depende del
notice, we
estado,
were
pero
invited to present as a
Ash
panel at the
presentó a
last
una
Build conference, and
conferencia de
there was a lot
un programa que
of
se llama Build.
recognition for
Oregon
the
fue
approach that we're
invitado
using,
para
that we're likely to lead to a more
presentar y hubo
equitable
mucha
system because of how
recognición sobre
we've
todo
been
lo que
engaging in
ha
this redesign
hecho
process.
Oregon y
And
todo
while
el
the
trabajo que ellos han
national
hecho con este
discourse is
proceso de
still
rediseño.
how do we fix QRISs to actually help us get to
La
those
pregunta
positive
nacional
outcomes?
todavía es cómo
There
podemos usar
is an
QRIS para
emphasis, a
al nivel
trend
nacionalidad.
towards dropping the R completely and saying it's about quality improvement systems and how are we supporting programs to have the resources they need and to build the type of care that really does meet the needs of the children and families and communities.
Pero la gran cosa es identificando que realmente
we have
a
people
la
saying,
nivel nacional
I
o aquí
wish
en
we could
estado,
be doing what
cómo
you're doing.
podemos hacer,
How are you doing this?
cómo
So
podemos
yes, I'd
seguir
say that we are
con
leading the pack in a lot
con
of
todo
ways
este
with this
programa
approach
para en
and this
realidad
vision that the
hacerlo,
accountability team has
hacer
created.
esto más fácil para los proveedores. Y Ash nos mencionó que en la conferencia que ellos atendieron al nivel
Okay,
nacional,
Liz.
Hi, thank you guys all for this
los
great
participantes de esos
presentation,
estados
great work. I know my
anotaron todo el trabajo
providers
que
in
Oregon
this
ha hecho y
region are
ellos
going to be
también
very excited about not
tomaron eso
having
para
to do
tratar de
portfolios.
querer
So
hacer
that
eso
in and of
los
itself
estados
is
donde ellos
I
viven.
think, huge step forward. I just wanted to piggyback off of
Lisa, de
Subin's
nuevo también
comment
les
a
damos
little
muchas
bit.
gracias por la
I
presentación
would
y
just
sus comentarios.
echo that the more
Y
seamless
quiero
that this
seguir
can be
que
for providers.
lo mismo que
And I would even
mencionó
go so
Subin,
far as to
y
suggest
de nuevo
that
que lo
maybe
más
some of
fácil que lo podamos
the
hacer este proceso para los
program leaders in
proveedores
other parts of
y luego
DELC
también
are being really
involucrando
mindful
a
as we're
los
setting rules and
directores
expectations
de
in those
DELC o los
programs of how
que
we can
se encargan
align
de los
all of these
programas
programs
de cómo realmente
together. So it's
podemos
not just up to
alinear
Spark to
todos los
align with what's
programas
there, but also asking,
todo, para que
does
nomás
Preschool
no,
Promise
no
need a
nomás
second
sea
look?
Spark
Do some of these other program
realineando todo directo,
requirements
pero para que
need to
todo
better
lo
align with what
dentro del
Spark's
departamento
doing in
de
terms of defining quality?
enfrentamiento
So I would
temprano.
just offer that One thing I
alineado
also
en
had
un
a specific
proceso
question on, because I was
compartido
digging
para
into
que no nomás
the
sea
supplemental
de
reading,
Spark, pero sino que
and I
sea todo.
noticed you were talking about the 2 tiers.
So,
The first being the
Liz
health
está
and
haciendo un
safety
comentario
requirements,
sobre
and then second,
los
some of those
dos
goal setting, you know,
niveles
sort of deep
y
dives, I guess.
la conversación
My
sobre las
question
metas
is,
y
how does that, those
creando las
health and
metas.
safety requirements and that tier 1, how, I know some of the folks who are going to be participating are not licensed providers, but for those who are thinking about the seamlessness, are those health and safety sorts of guidelines or requirements, I'm assuming those are aligning with licensing, and is there a way to just have that seamless so that all of the
La pregunta
providers
de
that are
Liz es
licensed
sobre
and
los
aren't having
requisitos de
any
salud y seguridad
findings
en
are
el primer nivel
automatically reaching
para
that
los
tier 1
proveedores o
status,
autoridades? Quiero saber si
and
esas
being part of Spark
requisitos de salud y
automatically?
seguridad están
I feel like
alineadas
there's an
con
opportunity between
las
licensing and Spark. If
licencias
the first
y
tier is
ella está
health and
notando
safety,
que
to
hay
just
conexión
automatically
con
have those providers
Spark y
reaching that tier
licencias
1
y
status.
cómo
And then that
podemos
hopefully encourages
conectar a
them to
todos
move
para
on
que
and explore other areas for growth. So those would
luego
be my
ellos puedan
comments
explorar
and
otras
questions.
áreas para
Thank
crecer
you,
en eso.
Councilmember Liz. Lauren, I wonder if maybe you would like to respond to that.
Ash le está preguntando a Lauren a ver si ella puede
Sure,
responder a
thank
esto.
you. Good morning again. Yes, we
Buenos
are
días.
in agreement that these multiple rules and expectations
Sí,
for
estamos
multiple
de
systems
acuerdo en que todas
is
estas
difficult and
reglas para
burdensome
todos estos
for
sistemas es muy
providers
difícil
and
para
frankly
proveedores
confusing
y realmente
for
muy
everyone.
confusos para todos.
So that is that's a really important part
Esto
of
es
this
una
process, is to make it
parte muy
as
importante
seamless
de
as
este
possible,
proceso
as
porque lo
simple as
queremos hacer
possible.
tan fácil,
And
más
that
fácil
said,
y simple para todos, pero con
we all
esto
have a very high priority on children's health and safety, and the
todos
accountability
tenemos una
team
prioridad
talked
grande
about
para
this
tener a los niños
often and extensively, especially as we were thinking about the
saludables
idea
y
that
con
we would
seguridad.
include license exempt programs who haven't been through some of those licensing requirements and visits. So the goal is absolutely yes. If somebody would come into this, as
La meta es
I think we're all visioning it.
sí.
If somebody would come to the Redesigned Spark system and say, "I'm
Si
licensed, here's
alguien
my number,"
viene a Spark y dice, mira, yo estoy licenciado,
that
este es
check,
mi número.
you're good.
Okay.
Because
Lo
those would
chequeamos
be
y estás
basically
bien.
all of the requirements that we want people
Porque
to
esos
meet.
serían todos los
And then
los
for folks
requisitos que
that
queremos que
are
todos
not licensed, we're
lleguen. Y
continuing
luego
to
para la gente que
discuss,
no tenga
what will
licencia,
be the requirements
seguir
that
con la
those folks will
conversación
need to
para que,
make.
okay, ¿qué son los requisitos que ustedes necesitan?
People that are regulated
O
subsidy will already have done quite a
gente
few
que son
things. So we're trying not to repeat things or reinvent the wheel. It's one of the cool things about having a
que son del
goal-based, an
subsidio
individual
regulado
goal-based
también
process,
para que
because
no
so many
tengan que
programs
repetir
are
el
setting goals
proceso.
for other initiatives
Ujú.
that they're working with, if they're in a focus network, if they're in Preschool Promise, if they're in Head Start, Baby Promise. And so those goals can just be moved right into, I'm participating in Spark and my
So hay
Preschool
muchos
Promise goals
programas
were
que están
this.
estableciendo sus
And
propias
I'm going to
metas y
move those into the Spark
objetivos
system so
y
Spark can support that process, and it
querríamos
becomes
que
just an
todos los
ally
programas como Baby
in the work
Promise,
that they're doing, just another
Preschool
support in the
Promise,
work they're
muevan esas
doing, rather
metas para
than
Spark para
like another
continuar
piece of
el
luggage they
soporte
gotta
y no
carry
para
around
que
with them,
sea algo
if that
diferente
makes
que todos
sense.
tengan que
So
hacer.
hopefully that addresses your
A
question.
ver si, ojalá eso
I add
le
one more
respondió a la
thing?
Please.
pregunta de
In
Elizabeth.
addition, the accountability team members, I'm thinking it was Claudia in particular, but now I'm second guessing myself,
El equipo de
was sharing how important it is
responsabilidad
not to put
también,
up a door and say you can't
Ash
come
está
in
diciendo
until
que creo
you've
que
had
fue
these health and safety
Claudia,
things. It's like, how can we get you connected to the resources so you can meet the health and safety
diciendo que si
requirements?
alguien viene
And
y
in our
no
conversations
tiene
with
todas
Alicia
las metas
at
necesarias,
Delk,
¿cómo podemos
she really likes
comunicarnos
this idea
con
of stepping
proveedores
stones,
o
right? So we're saying,
programas y
here's
ayudándoles para
where we
decirles,
could
ok,
start, and here's
esto es
how
donde
we
podemos empezar y
advance
luego
the
aquí es
different
como te
health
podemos
and safety
ayudar
requirements.
para
Again, with support,
avanzar
right? We don't want to put an
esos
expectation and
requisitos
then
de
turn people away. We
salud
want to get them
y
connected to the
seguridad,
support.
porque en realidad queremos conectar a gente a
Thanks.
los
Ruby.
soportes y no nomás no ayudarles con el proceso.
I was going to see, Subin, did you have a comment related to this? No, okay. So thank you, Ash and team. Really great to hear this
Gracias también,
update. It's
Ash y
been a
equipo.
while, right? And I'm
Muchísimas
also
gracias
thinking
por
about, folks
escuchar sobre
haven't
Spark.
really been aware of what's been going on with Spark for a minute. And
mencionando
to
que
Subin's point,
no hemos
this
tenido
work
noticias
takes a
sobre
long
Spark
time,
y
and I
sabemos
was
que
also
este
looking
trabajo
through
dura mucho.
the supplemental
Y yo
materials. And
también
so I have two
estaba
comments and a
revisando
question.
las
And I
materiales
just
que
want
Ash
folks who might be
nos mandó
listening
y
in the
también tengo
council to
dos
really
preguntas.
understand the scale of engagement and why this has taken such a long time, right? I saw
Y
that
también nomás quiero
you
anotar
all
y quiero que
engaged
gente que
600
está
plus Spanish-speaking parents and
que
providers,
están
and you engaged
aquí en la
1,500
llamada,
parents and
que
providers, I think,
ustedes
overall, or
involucraron
is
a
maybe that's
600
separate from the
padres que hablan
Spanish-speaking?
español
So
y
overall, great. So I
1,500
just
otros
want to
padres. So
recognize
nomás queremos
the time and attention it takes to engage that many folks that are on the ground and hear all these diverse
queremos
perspectives,
enseñarles
and
a
then
todos
be able
que
to
en realidad
digest it
todo este
and
trabajo que
incorporate
ustedes hicieron
research
no
and
es
really think through what a
no es
vision
algo
looks like
fácil.
for this work. So I applaud you
Fue
for that.
mucha
I am also
involucración de
really
padres
excited
y
about
me da
your
mucho
understanding
entusiasmo
of
sobre el
the diverse
entendido
needs
de
of children and
la
families across the
diversidad
state and how
y
we're defining
las
quality.
necesidades que todas
Quality
las
is not
familias
something that
necesitan y cómo
it has a
estamos
national consensus about what that word means. And so I
y
really
cómo
appreciate
definiendo calidad,
looking at this through a
porque de
different
un
lens that really
nivel
supports all
nacional
families across the state.
todos tienen
And I think that's
diferente
really
definición
important.
de
And
la
I think
palabra
Oregon can
calidad
be a leader in
y
defining what
es muy
quality means for
importante
all families. So
todo el trabajo
appreciate
que
that
ustedes
work
están
that's
hecho
happening
y
as well.
muchas
My
gracias por el trabajo que ustedes
only
están
question
haciendo
actually
sobre esto
is
y
really
la
knowing
calidad
that
de
this has
servicios
taken a
aquí en
while to
Oregón.
get to where we're at, do you
So,
all have
sabiendo que
ideas
todo esto
about
ha
a
tenido
timeline for the
ha
implementation
tomado tiempo,
stage, whatever
que
that looks
la
like,
pregunta de Ruby
what you
es si
need to make that
ustedes
happen,
tienen
if the council can be supportive in some additional ways in
un
terms of moving to
línea de tiempo
implementation,
para
or
saber
just some general
exactamente
information so
cuándo
that
esto se
folks
va a
know
poder mover
kind
para
of what they can
implementación,
expect in the future.
para saber exactamente qué podemos esperar
Thank you,
sobre un
Councilmember Ruby. I appreciate all of your comments and the acknowledgement of the time it takes to engage in this way.
sobre un update. Y Ash está dando gracias por
So the timeline, I knew that question was coming.
por reconocer cuánto
And
tiempo ha
in
durado
doing this work,
todo
it's
esto.
come
Y
to,
estaba esperando la
for
pregunta
myself,
de
I feel
línea
like
de
it's more
tiempo.
about kind of like milestones, and we can't always have
Dice que
a super rigid date
para
of when
Ash,
this thing will happen,
este
but we can
proceso
have a
es
vision of what are
realmente
the things that
sobre
we're putting in motion and have better
hitos
communication
y
and
no
connection with you
necesariamente
all of
cuándo
potential
vamos a llegar a
barriers that we're
implementación,
encountering
pero qué
that can
vamos a
help us
hacer mientras
keep
llegamos ahí
moving
para
in the direction
poder
of the
seguir
accountability team's
moviéndonos
vision.
en la dirección
So
del equipo de
there are some
responsabilidad y la
things that are
visión de
already
ellos.
in motion, like we were talking
So,
about
si
the
hay
quality
cosas que
improvement
ya
cycle. That's
están
very similar
en
to what
proceso.
they've proposed, and so we're going to pilot and test and try some new things out in
So,
there,
vamos a
test it out, see how it's
empezarlos
going, do
a
smaller
hacer test
group
y luego a
sizes
ver
of
cómo
people going
sirven.
through and
Vamos a
giving
hacer grupos
feedback.
más chicos para
So
poder
it's not
todavía
like we're
agarrar
going to be waiting years for changes. Changes are already
comentarios.
happening right now.
No vamos a esperar años para los cambios, porque los cambios ya están
For
pasando ahorita.
implementation, the
Pero para
big focus next
implementación,
is the DELC
el
support
gran
group, bringing more
focus
DELC
es
involvement
el
into this work to help us
grupo de apoyo de
get
DELC, porque sí
a
ocupamos
solid
más
grounding,
apoyo
making
para
sure we really
poder
are aligned and
saber
complying
que sí
with
estamos
statutes
alineados con
and state and
las
federal
leyes y
regulations,
con las
as well as
regulaciones del Estado,
identifying and really
federales,
creating that
y
analysis of
identificando
current Spark
el
connections.
análisis de
What of those would need to be
conexiones de Spark
changed?
presentes,
What
qué
with
tiene
new
que
Spark,
cambiar,
what
y
connections
con el
might
nuevo
need to
Spark, qué
be
conexiones
created,
tenemos
right?
que
So
crear.
that's really a big focus
Y
of our
eso es un
next
gran
step, as
enfoque
well as
sobre
working
lo que va a
with the accountability
seguir
team, TRI, and other partners
con
around
TRI,
building out some
el
of the
Spark Team, y
details. So
luego más,
I do
todavía no
believe
tenemos más
that
detalles, pero
we'll see quite a bit more happening at the
creo que
beginning of the
sí
next
vamos a
biennium,
ver más
and would
pasando
love to set
al
up a way to engage with you
empiezo
more
del
regularly,
siguiente
because a lot happened and we
bienio,
had so much to
y
catch
me
you up on
gustaría
in one
regresar
presentation.
y seguir
Did that
presentando con
answer
ustedes para
your
poder
question well enough for the
seguir
moment?
compartiendo todo lo
Yes.
que está pasando.
Thanks, Ash. Robin and then Marie.
Okay, gracias, Ash. Y
I
ahora
just want to
Robin y
echo what
luego
Ruby
María.
said in gratitude for how much time and attention
De
and
nuevo,
voices that you've
yo también les
included
quiero dar
to
muchas
get to
gracias
this
por
point
todo
in
el trabajo que
the
ustedes han hecho y las
updates to
voces que han
Spark.
incluido
And I was
para
just
llegar a
reflecting
este
back.
tiempo. Y yo estoy
I've been around a little while, and
yo
I was
estoy
reflecting
reflejando
back of when Oregon entered the
de
QRIS
cuando
game
Oregon entró
and
el
thinking about your reflections on
juego
do
de
we need the
QRIS
R or
y
not.
pensando en las
I was
reflexiones de estados de las
thinking
reflexiones
about
de Ash
how
de
if
deberíamos de
I'm a
remover
family,
la
and so I'm so
R.
glad you have so many
Y
families helping you
sé que le
to
da mucho
shape this,
orgullo que
because
hay
if
muchas
I'm a
familias
family and I just
involucrados
get a
para
list from either 211
ayudar
or
con
I
esto.
find some
Y
list of
ella se está
providers
poniendo,
who
si yo
might be
era
available to me in
una
my
familia y
location,
si yo nomás
who might have
recibía
openings
una
for
lista
kids
de
my age.
211 con
I remember us
nomás
really
diciendo,
grappling
ok,
with
ellos tienen
how do we help
disponibilidad con una lista de
families
proveedores
make informed
y
decisions, like what
ellos
kind
tienen
of
capacidad
ways
de tener a
do
tu niño
families
también la edad, pero
make
realmente
selections,
es,
and obviously the
queremos
best case scenario is that they
darles la
meet
oportunidad
each
a los padres
individual
para
and
que
find a
ellos
best
sean
relationship
empoderados
fit for
para
the family
encontrar lo que
culturally and
mejor les
linguistically and
lo que ellos
proximity,
mejor
like all
quieren
the
y lo que
reasons
mejor
that a
sería
parent
mejor
might
para
choose.
su
So
familia,
I'm
para su hijo.
curious,
Hay varias razones que
are you also having
no nomás pueden
families
seleccionar
inform
un
that process?
proveedor,
Like how will
pero
it be? What do families need to make
su
informed
pregunta es,
decisions when they're
también
selecting
están
childcare if they
involucrando
don't
a las
meet
familias en
20
este
people on the
proceso.
list, if they're lucky to have more than
¿Cómo
2
están
people on the
involucrando a las
list that
familias
are
si
meeting that
tienen una lista
criteria
de
with the lack of
proveedores
childcare that we currently have?
que tienen la criteria que ellos seleccionaron
Can someone
y
maybe help me with that, Ash?
Yeah,
¿Y
thank you,
cómo les están
Council
ayudando
Member
a
Martin.
estas familias para ayudar a
I
encontrar a alguien?
think in Sage's response in the recording that was shared, she really
Sé que en
emphasized how the
lo
way
que
we will
Sage
structure kind
mencionó
of
en
those
su
goal
respuesta de video,
categories, the way that they'll be able to showcase a specific example of, like,
en
for
las
example,
categorías de
inclusion. What is this
objetivos,
program doing? What does it actually look like in
un
their
ejemplo,
program, so that
con
the parent can
inclusión,
see,
queremos saber
they know
exactamente cómo
I
inclusión se
prioritize,
mira
it's important to
en
me that
unos
they have
programas. Si
great
para
inclusion
un padre
practices, and then
algo
look
es
at it and see,
inclusión es
oh,
importante,
that's not
nosotros
quite aligned with
queremos
what I would like to see
tratar
around
de
inclusion
darles más
practices,
información sobre
and
las prácticas de
it would
inclusión
allow
en
them
ciertos programas
better
para
information
poder
to
darles más
make an informed
información a
choice, because
padres
the
y
3, 4, and
familias
5
para que
star
puedan hacer
nationally,
una
they say it
selección
hides
informada.
the elements of qualities, it collapses it into one, and so families don't know that one program, for example, could be at a 3 star, but they have amazing inclusion practices,
Porque
but they
sabiendo,
didn't meet the
Ash está
personnel
mencionando sobre
qualification,
los
so they're at a
programas
3,
y la nivel de
right?
las
And so
estrellas,
the
¿verdad?
3, 4, and
Un
5 is
ejemplo,
not helping
las
families,
estrellas
and
3,
so
4 y 5
this
no les
way
están
of
ayudando
goal
a las
setting and
familias porque
showcasing
realmente no
their
les está dando más
accomplishments
información
and
sobre
what it
lo
looks
que
like
ellos
to
quieren
that
seleccionar.
program is
So,
intended to help
este
the families
proceso
make the more informed
sí
choices. And I don't know,
les quiere
Sage,
ayudar a
do
las
you have
familias para
anything else or
darles
any other
más
accountability members want to add to that?
selección, una
I guess I would
selección más
say that
informada.
people also can connect to all the community organizations out there that are already in place with DELC, and they can use those to help parents find the Spark website and look at the Spark website and understand it. And if it's individualized where programs are unique more than just a star rating, parents will have something
También
meaningful
quiero
to look
anotar
at
que
when
personas
referred to
pueden
that, rather than
conectarse con
referred
las
to somewhere
organizaciones
on the internet
comunitarias
with
o
a
del
fairly
departamento
meaningless
y
rating
usar esto
system as
para
it is
ayudarle a
currently.
los padres a encontrar el sitio de web de Spark para que ellos también puedan utilizar
Thank you,
ese sitio
Sage.
para encontrar lo que ellos
And
quieren.
thanks, Ash, for that response. Marie.
Muchas gracias, Sage, y también muchas gracias, Ash, por esa respuesta.
Hi,
María.
I was just gonna ask, I'm
Yo nomás
presuming
quería
that
preguntar,
sort of your North Star is that you all are looking to have programs work with you and integrate this into their businesses. So with that as sort of what I'm presuming, and if I'm off, let
supongo
me
que su
know
estrella
your
del
North
norte
Star
es
is, I
tener
wonder
programas
if
que
you are
trabajen con
tracking
ustedes,
number
integren
of
esto en sus
participants or
negocios.
percentage of providers
Ustedes están
overall
tomando en
throughout the
cuenta
state, both urban and
cuántos
rural, who are
programas o
participating,
negocios que
and
están
are you
participando con
creating
ustedes,
some goals and
también en áreas
benchmarks for your
rurales,
team
y
in
están
terms
creando
of
metas y
outreach
objetivos con su
and
equipo en
participation in the
relación
SPARK program?
en relación de
Thank you, Councilmember Murray.
alcanzando
Excellent
más
question.
programas y con quién se
So
quieren
the
comunicar.
outreach
Muchas
and
gracias
as
por
well as
esa
the transition
pregunta.
plan of like current
En
programs into Future Spark
comunicándose
and
y el
bringing
plan
new
de
programs
transición
in
para
is going to be part of our
traer
planning
más
that we'll need
programas
to
a
be
Spark es
developing.
parte de
First, we need to get more of the
de
details figured
nuestros
out, and then
planes.
we will be
Todavía hay
really
más
focusing
detalles
efforts
para
around that. And we
identificar, pero
do
luego sí
track
vamos a enfocarnos sobre
how many
eso.
programs
Y
are in
sí estamos
Spark, what
tomando en
star
cuenta
level, where
cuántos
are they
programas están en
located,
Spark,
all of
en
that.
qué
And like
nivel de estrella
Sage was
están y
reporting
en cuál
earlier
área
was
de
saying
Oregon
how
están.
in rural areas there are
Y en las
very few
áreas
programs
rurales
participating,
hay
very few star
muy
rated
pocos
programs. So
programas
we are
participando
absolutely
y muy pocos
excited to
programas en
do a
el
better job of getting them
que
engaged
están
in this design that
involucrados
this
en el nivel de
accountability team
estrellas.
created.
So, sí
There's
estamos
people
muy
already out in community saying that
orgullosos
is
para
what I want to be a
comunicarnos
part
con
of. I
más
didn't want to be a part of the
programas
old Spark, but I want to be a part of that. So I think that's really going to help.
para ayudarles con ese. Y he notado que hay
And like
muchos
Subin was
programas
saying,
que
it
se
was
han
designed
comunicado
with them.
con
Yeah,
Ash
no,
diciendo que
that's
yo
great.
quiero
I
ser
was just
parte de
wondering if
Spark.
you had that
Antes, en
information
el
in terms of
programa
percentages or
antes,
numbers.
que era
Maybe that's
Spark
something
antes,
that could
hay
be
muchos
shared, and
proveedores
then
y programas que no
maybe
querían
what your
estando
goals are for
involucrados.
participation in
Pero
urban and rural,
ahora
excuse me,
sí.
rural,
Y Mario
or
ahorita está
maybe if
preguntando
there's a
si
check back opportunity at some
tienes
point in the future, or whatever
un número
time
en
frame that
mente
is, to be
de
able to
tu
show
meta
like where we
sobre
are now
yo.
and
El
how the
programa se quiere
changes have
comunicar con X
promoted
número
people to
de
sort of
programas y
want to
proveedores.
adopt all of the work
No
that
sé si
y'all have
tienes
done.
información o no, pero también quisiera nomás saber
Yeah.
para que
Great
podamos ver,
question, Marie, and
ok, y
it's
nosotros
reflective of the
queremos
fact that
comunicarnos
council's
y
really
conectar con
interested in,
cierto number y luego regresar y
data
decir,
and
mira, esta era
tracking
nuestra
progress,
meta
and that's
y
something
esto
we'll
era
be
lo que,
looking
y
at
con este número nos
for the whole
conectamos.
year.
Y nomás están notando
So,
que
and I think some of that, these updates, so it won't be another 2 years before we hear from Spark again.
al
I
Consejo de
think some of
Aprendizaje
that can
Temprano,
be,
este grupo de
in
individuales,
background
les
materials
gusta
provided in our packets.
saber
So,
información y
sort
nomás
of
están
following
notando
up on
que
what
si no es
Robin was saying
si no
earlier.
es
Okay, last question,
tratando de regresar
and
para dar
then
más
we have to
información
move on to
verbal,
the agency
queremos nomás
presentations.
avisarles que
Subin.
también
I
siempre
have
pueden
4 things.
ponernos
I'll be quick. You
información
won't be able to respond to all of them.
para
One is
que nomás
the
podemos incluir en nuestro paquete
another
para que
problem
los
of
participantes
practice
lo
that I
vean.
recall from just engaging other programs is the cost to participate. And what I mean by
So,
that
también
is,
quiero
and this is
anotar el
occurring with
costo de
licensing too.
participar.
If a business has to make a
También con
change or
licencias, si
kind of
un
make an
negocio tiene que
improvement,
hacer un
it
cambio,
represents cost. And so
eso
I'd love
representa
to understand
gastos.
that better. What are those barriers?
So,
And in
quisiera
the new
entender
proposed design of getting, an award
qué son
about,
los problemas
I just don't know if that's
sobre el
enough
gasto
to
o
kind
qué
of cover
son
the
las
cost that
barreras
some people will
para
have to
cubrir
do.
el
Okay,
costo
second,
que hay mucha gente
I
que
feel
a
like
veces
an
tiene que hacer.
opportunity that
También
should be
yo siento
explored is
que
some kind of data sharing agreement
una
with
oportunidad
all these
sobre
other entities that we talked about, whether it's licensing,
un
Oro,
acuerdo de
Preschool
intercambio de
Promise, Head
datos con
Start,
sobre
whatever,
todos estos
that
programas para
when
poder
people enter
compartir
into
datos
the
para
Spark
que
rate, the
cuando
C2Q,
gente
right, when they
entra
get into that
al
process,
Spark
there's a
website o
lot
al
of
CQ2
information already filled
ya
out,
hay
right? It
información
says,
y
we
nada.
already know this about your staff,
Y
about
diciendo,
you,
ya
about your
sabemos todo
program, and
esto
that would
de
help
ti,
a
de
lot,
tus
right?
empleadores, de tu
Another
programa,
thing
y
that I
esto
just don't
ayudaría
want to
mucho.
lose is
Y
a
también nomás
big
no
thing
quiero
the
perder
council is
esto,
worried about is building
que
supply. We
algo
need
que
to
el Consejo de
build new
Aprendizaje
supply. And so we
Temprano
need to think
está
about what
preocupado sobre
new entrants, what that process looks like, and how to make it as easy as
creciendo
possible, how to
más
incentivize and
proveedores y
create
cómo crear
meaningful
más
reasons why
trabajos, más
people should be
programas
getting
para
engaged.
ayudarlos para
And then to
que
Robin's
podamos
point,
crear más
that
razones para que
design of
gente
what it
quiera
looks like on
estar
the back
involucrado
end,
en
once
estos
you have
programas.
that whole process figured out, making sure it looks easy and that people can find the information that they want, I think is something that, like, whether the design is centralized, it doesn't, the output doesn't have to be centralized. You can go to your community entities, but taking care of what that looks like, I think should be an important thing that the group works on. All right, thanks.
Pamela, can I respond or are we at time?
Disculpa.
You have 1 minute.
Okay, y Ash tiene un minuto para poder responder.
First comment,
el primer
there's
comentario,
opportunities to have different types of practices
tener
that are smaller steps,
oportunidades
smaller
para tener
costs as
diferentes
well.
prácticas que
But yes, we are certainly
cuestan menos,
pursuing
pero sí
making sure there's
estamos
adequate
mirando
funding
para
so that programs
asegurarnos que
can
hay
implement the
suficientes
changes that they
fondos
need to.
para que los
Second,
programas
data sharing
puedan
agreement, yes, please.
poner
And
en efecto
then
los cambios que ellos
building
necesitan.
supply, new
Y luego
entrants, what I would
también
say to that makes me think of, I think it was Fernanda
para
from the
tratar
accountability
de
team
tener más
sharing that
interés
if
en
this is word of
siendo
mouth,
proveedores.
this person, I'm a
Esto
provider,
es
I found about Spark. Oh, you're caring for
realmente
two
es
people in your community.
compartiendo
Come on in, get connected, find out that
Y-
licensing is an option, other connections, other supports,
Perdón,
and really finding a
conectándose con
way to
gente
map
verbalmente
out
y diciéndole, mira,
some
yo
maybe goal
participé en Spark,
cycles that
eso es lo
can
que
help
yo hice,
programs that are
para poder
interested in
ayudarles en
becoming
los programas
licensing,
para que ellos
understand what are some of the
estén
steps and how to move in
interesados y
that
luego ellos
direction so
así
then
sepan
they can
exactamente
provide care to more children in their community.
qué son los pasos para poder entrar al programa.
All right.
Okay,
Thank
muchas
you, Ash, for the
gracias.
rapid fire. the question I would throw out, but we can't answer it today, is
Mi
do you
pregunta,
have the
que sé que no
capacity to
podemos
deal with this,
responder hoy,
especially now that it's
¿tienen la
available for
capacidad
everybody,
de
including
hacer todo eso, ya
non-licensed
que ahora
providers?
está
So
disponible
it'd be
para
great to
todos los
understand
proveedores,
how
incluyendo
that's
esos
going
que
to
no
work.
están
For Miller,
licenciados?
it will be a phased expansion. So we're not going to do day one. We
Ash
need to make
dice
sure
que
we
va
have the
a
adequate
ser
supports in place.
Got it. Thanks, Ash.
a
Thank
expansión
you,
gradual
Ash
y no va a
and
ser algo como
Haleb
más
and
pasa
all of
regular.
the
Les quiero dar gracias a
accountability
todos,
team
a
members for
Ash, a
joining
Haleb
us
y a
today.
todos el
We
equipo de
appreciate your
responsabilidad por
input.
ayudar,
We
por
also
estar aquí con
appreciate all of the
nosotros.
time that
Y
you have
todo el tiempo que todos
invested
ustedes han
as you
investado
redesigned this.
con
And
este
Lauren at
rediseño. Y
Western,
Lauren
we
en
appreciate
Western
your
también,
partnership
muchísimas
as
gracias
well.
por tu
So have a
participación.
great day.
Que tengan un buen día.
And we're going to move on to our agency partners who have begun to show up. And welcome all of you. Thank you for joining us in what is probably a super crazy busy day in Salem, is my guess, because of the ledge days that are going on. So we know that many of the agency directors are tied up at the Capitol, and we appreciate you leadership staff joining us today. So thank you. Let's see. We are going to, I guess we'll just go down in the order that's here. And Chelsea, thank you for joining us and representing Director Bell today. And it's always fun to see you because you've been involved with us for many, many years.
I think the whole time that I've been with OHCS, I've had the privilege of working in deep partnership with you all at the council and with Delk. So it's pretty cool. This is one of my favorite parts of my job. So.
Oh, good. We appreciate that. It's also one of our favorite parts on the agenda. So what is happening in housing? Because we hear nobody's prioritizing it this year. We understand.
I love that. Well, good morning, everyone. For the record, my name is Chelsea Bunch. I use she, her, hers pronouns. I am the director of Equity, Diversity, Inclusion here at OHCS, Oregon Housing and Community Services. And like Sue said, have had the pleasure of really serving on this team, I think since probably 2018. So quite a long time. Really happy to be here with you today. Chair Miller, we are, and as you know, I am stepping in for Andrea, so just bear with me here. So we are going to talk a little bit about the governor's recommended budget for the agency and talk to you a little bit about what was funded and what was not funded in the GRB, what did not make it into the GRB. So I actually think that I would like to start with what was not included in the GRB. This is a tricky one to share, but you all may be familiar with the CARE program. So this is our co-location fund, facilities fund. And these resources that we received $10 million previously in a previous biennial budget, really focused on supporting affordable housing developers, childcare providers, facilities providers to work together to kind of imagine and begin to, in real time, build out co-located properties, right? Unfortunately, we did not get our ask, and let me look at our document here. I think we requested and asked for another $10 million. That did not make it in the governor's recommended budget. So as I think about opportunities for support, there may be some support that we could use right in this legislative session to maybe get that back in there. That has been you all might remember that the CARE program certainly came out of our deep partnership together. And so that program has been new for us, but also really pretty cool to rethink how we partner and how we support partners and developers on the ground in real time to do some real sticks and bricks development inclusive of childcare centers. So I want to start there. What I will say is that I certainly believe, and I certainly am speaking on behalf of Director Bill, and I believe that she would say the same thing, is that in spite of the CARE program not being included within our GRB, I do still really strongly believe that our what was included in our GRB really is reflective of our own values for how we make sure that we can keep people housed, get people housed. So that really is, I think, the framing, and that's really important to keep families stable, right? Is making sure that there's stable housing. So some of the resources that are included for us in the governor's recommended budget include, like I mentioned before, resources to maintain our ability to keep folks housed, to get folks into housing. That includes resources for sustaining rehousing. So folks who may have transitioned out for whatever reason outside of housing, may be unhoused, that we can get them back into stable housing. Resources to continue to sustain long-term rental assistance, which as I think about how we support families, resources like long-term rental assistance, particularly when market rate housing is skyrocketing, rents are high, those types of sustainable resources will continue to play a really critical role in maintaining family stability. And then also continuing to prevent evictions. So that's been another huge body of work for us ongoing over the years, is being able to work with our partners to put resources out to prevent evictions across the state. We also, what also has been included, we're really excited about, is our ability to maintain investments in tribal housing via a grant program. And I think that particular bucket of investments, we are really interested in how we expand eligibility within that grant program for tribes, so that tribes have the opportunity to say, here's what our unique needs are as a tribe. Maybe that is increased shelter access, maybe that is rental assistance, maybe that is sticks and bricks home ownership development. But that tribes have the ability to name the need, and that we have the ability to resource them to move that work forward. So really excited about that addition. You all have likely heard us come in past years talk about the Local Innovation and Fast Track program, otherwise known as the LIFT program. I just as a, I always have to remind myself, when I started at this agency in 2017, one of the early asks for LIFT was $40 million. And we thought, man, that's a lot of money. This is really great. And that investment has really increased over time. This is one of those investments where we really are wanting to incentivize larger family-sized units. So this is looking at units that are most likely 2-bedroom, 3-bedroom and above. And that we can incentivize via funding developers to build more family-sized units. We got more LIFT funding is included in the GRB to the tune of $700 million. So that's going to be, let me, I should clarify that, because that is via Article Q bonds. So the financing, folks, that is not my forte. So I'm sure that there's some interesting points of how we got that $700 million, but more funds for LIFT. We continue to receive funds for things like down payment assistance, foreclosure prevention. Again, really important for family stability, thinking about families who are living in housing and just trying to maintain the house, right? Costs a lot of money. And sometimes people are having to make really hard choices about what they will and won't maintain. So there's definitely resources in for foreclosure assistance, counseling, down payment assistance. And I believe those are probably the big key ones. I think housing does continue to be a priority. I think even in this governor's recommended budget, and certainly this doesn't encompass all of the things that I shared here, but over $830 million, which we are really fortunate, and we have a large task ahead of us over the next couple of years to get these resources out. But I think we feel really confident in being able to do so, and really feel like this continues to be very much so aligned with how we see ourselves operating in communities around the state. So that is,
Wow.
it's a lot.
That
I'm
is
certainly
a
down for
lot.
questions, either now or later.
Okay, Council, I'd like to hold questions, and I'm guessing there may certainly be some. And let other agency reps present their GRB information. And then Chelsea, thank you very much. That's quite a task you guys have ahead. Yes, okay. Ben Cannon, welcome, Ben. Good to see you again.
Yeah, thanks. Can you hear me, Sue?
Yes.
Okay, great.
Thank
Hello,
you.
everybody. Good to see you all again as well. Just a very brief update on the Higher Education Coordinating Commission's governor recommended budget. I'll focus on the issue that I've discussed with you before, or our proposal that I've discussed with you before, that is not funded in the governor's recommended budget. Unfortunately, that was the proposal to fund the Early Learning Professionals Grant Program that would help defray college expenses for folks seeking degrees in fields related to early childhood education and care. So that was a policy option package that we had submitted in our agency request budget and was not funded in the governor's request budget. That's consistent broadly with the approach the governor took to the HECS GRB, which is largely a current service level approach. So I think that's sort of the simplest way of understanding the HECS GRB. It is by and large current service level. We know for our colleges and universities that does create some challenges insofar as their the rising costs of continuing their current programs are not fully met by the CSL determination of the state. And so under a CSL budget, they likely either have to increase tuition rates at levels that they certainly don't want to, and we would prefer them not to, or cut programs. So I expect that they will be advocating, as they have in past sessions, for additional funding over and above that CSL that's in the governor's budget. Otherwise, there are some adjustments to CSL and the GRB, including a modest increase that the governor has proposed to our core need-based state grant program that would support some of the same students who would have been served by the professionals grant, basically high-need students, undergraduate students seeking any type of degree through and qualifying for the Oregon Opportunity Grant. So we saw a modest increase to that in the GRB, a few modest cuts, and some other slight departures from GRB from CSL. The only other point I'll mention is we are working closely with the governor's office and the Oregon Health Authority and others to build out policy related to the governor's behavioral health initiative. That behavioral health initiative includes a workforce investment that the HEC would deploy. There's a related workforce investment through OHA, but the HEC's piece of that would focus on, again, scholarships for folks headed towards careers in behavioral health, as well as grant making to colleges, universities, and training providers to help expand their programs and strengthen their programs related to behavioral health. So, and obviously some intersection with early childhood there, although not specifically targeted. That's the HEC report.
All right, thank you, Ben. So speaking of OHA and behavioral health, which is another huge priority in this state, Dave, how about if we jump to you, and thank you very much for joining us again.
Yeah, thanks, Sue. Hey, everyone. Dave Baden, he, him pronouns, Deputy Director for Policy and Programs for OHA. It's the glories of a complex. I was really hoping that OHA would pass the $40 billion figure for a biennial budget. We're really close. So our overall budget is about $39.6 billion that we're asking for, which we tried to do the math the other day of how much money OHA spends every second. When you have that much money, it's a lot, actually. It was like $300 per second or something. It's like, wow. Anyway, it's
Are you going to charge us for your time here, Dave?
$300 per second.
A second. Okay, we'll drop that.
That's totally what $300 per second. I'm worth every penny.
Every penny.
Every penny. So yeah, so there's I think we talked about in here the process to put the governor's budget together was a little bit different than before. And what preceded this, which was each agency did its own budget. In this time, they were sort of constricted a little bit down to sort of a 1% growth in general fund. But then when we got to the governor's budget timeframe, I think all of us, I think Ben and all of the other agency directors, I think we were really worried because the forecast, the economic forecast was more bleak to cover all of our costs. Thankfully, luckily, is that the most recent economic forecast did have additional dollars both for this biennium, which carries into next biennium, and next biennium. So there are probably more things funded than would have been. And this does include, I think, things, particular interest for the Early Learning Council related there. So maybe to follow from Ben is, there is some additional, resources in OHA for behavioral health workforce. The biggest piece is a continued commitment from the state to expand Oregon's residential mental health and substance use disorder treatment capacity with more treatment facilities, with I think a particular focus on kids this time. So 10 million dedicated to expanding psychiatric and sub-treatment capacity specifically for children in that piece. Obviously the dearth of treatment capacity for, I would say, especially substance use disorder treatment for all people in Oregon, but especially kids, is very real. So the governor's budget does have a specific investment in additional treatment capacity around also $25 million ask for additional money for behavioral health workforce investments. Building all these facilities is great, but if we don't have people to actually staff said facilities, with especially a focus on and sort of the behavioral health and substance use area of recruiting more and more diverse providers, getting people into school that reflect a growing, diversifying population of the state. Clearly, someone seeing a counselor or someone seeing someone about their addiction, it's a lot easier to feel and be around someone that may speak your language, sort of you feel more confident and comfortable with. So that is a big focus on those pieces. There's an additional, specifically nearly $15 million around behavioral health services for youth, including $6 million for school-based mental health services and substance use screening and prevention through school-based health centers. Talked about this a lot in the ELC about the importance of school-based health centers and school-based mental health services. So the governor's budget has a pretty significant increase for those particular services. $1 million to expand youth suicide prevention programs, especially for youth of color, and $7 million to deliver intensive in-home behavioral health treatment for children and youth there. So you could see multi-tens of millions of dollars investments specifically in kids, specifically under sort of the overall behavioral health initiative umbrella that Ben had mentioned, that has some work for HEC and others around some workforce and other capacity. So a lot of focus on kids, opening up more treatment parameters in schools, linking, with a particular focus on, again, sort of in-home, intensive in-home treatment as well. So I think a lot of good core set increases to go to the legislature and have lots of good discussions about sort of where this ends up through the legislative process. Switching gears for a second around Medicaid. So Medicaid is fully funded. The Healthier Oregon program is fully funded. That, again, the Healthier Oregon program is Medicaid that would be provided to people in Oregon who would qualify for Medicaid except for their immigration status. So that program is fully funded as well in Oregon. Again, things that we've talked about in Medicaid are continuous eligibility for kids up to age 6 continues. Adult eligibility for 2 years, all of that continues. The work that we've been doing and have talked about in, rolling out housing benefits, nutrition benefits will start for a subset of the Medicaid population here next month. So I think, and that includes re-upping a provider tax package that is sort of a part of the core benefit in Medicaid. So it takes a lot to fully fund Medicaid. It's a huge part of the state budget and a big commitment for the state to continue to provide a robust Oregon health plan throughout the state. A couple other spots, and then happy to take questions around $5 million in the public health world to protect and expand access to reproductive health care, especially just assuring that that Oregon is as well placed as it possibly can in case there's any federal disruptions in funding that, around Title X or other funding that potentially had in the past been at risk because of provisions that were put in that. Plus around $2.5 million to support traditional health workers in Oregon around ensuring meaningful access to inclusive services and facilities with a big focus on language access and disability access. There is a lot of other things that is part of OHA's $40 billion total ask. I'll also try to post our couple of things in the chat here for some links to our budget. I think the governor's budget does a good job of talking about OHA investments. But, I think the governor's commitment to housing, the governor's commitment to early childhood programs, and I think to behavioral health really comes through in this budget request.
All right. Thank you, Dave. A lot of exciting programs that are funded. Yeah, and many of which obviously affect our kids and their families. Let's go to Joel Metlin. Welcome, Joel, who's here in place of Alyssa. So we're glad to have you here.
Thank you, Chair Miller. Hi, everyone. Joel Metlin, he, him, his pronouns, Deputy Director of Programs for DELC. And we have some slides here for you all, just in case you're more of a visual person. So in general, I'll go ahead and go to the next slide. Just to remind you all where we started with agency request budget, as this is a 3-step process. So next slide. We were limited to that 1% of general fund budget. So for us meant less than $6 million that we could ask for on top of that current service level. The exceptions to that were for some of the things you're seeing investments in the governor's budget for, like behavioral health, and for DELC specifically, that's our literacy work and the Birth Through 5 literacy plan. And so we were already expecting sort of limited and targeted investments as we were moving forward. Okay, next slide. So just a reminder, our total agency request budget was $1.5 billion, way short of Dave's almost $40 billion. But we did have some key investments that we were asking for in POPs, basically in foundations as we're a new agency, and making sure that we're shoring up both the agency and then promoting access to our core programs. Next slide. So in case you haven't seen it related to the governor's budget as a whole, this budget was called Building on Progress, and there were sort of 3 goal areas the governor was working towards, which are on here on the screen. And, for the council, I think all 3 are important, and especially that third one, where the promise of every child is realized. And so it's sort of the guiding principles to what came out in GRB. Go ahead, next slide. All right, so specifically for DELC, the core thing here is that the governor is really looking to maintain that focus on early literacy and to just establish Oregon as a predictable funder in early learning. So what you'll see is that the funding is stabilized. There's no reductions to any of our programs or operations. And there was also new investments made, about 25 million. One of the things to note is that with the ERDC program, there was going to be a hole due to ARPA funding ending, that federal funding. So the GRB does include 117 million in general fund to backfill for that, so that we can maintain that current service level. But there weren't any new investments in ERDC, so that is something to note, that our current service level is far less than the number of people who are even on the program right now. So next, we did get higher service and supplies budget to account for increases in our operating costs, things like laptops. And in the last thing is that we did get our inflationary adjustments, which totaled up to about 78 million, so that as folks, especially like our providers, have experienced increased cost, this inflationary increase to help them cover that as part of payments. Okay, next slide. All right, so in terms of actual POPs that we put forward, we were successful with all of the POPs. They were part of the budget. As a reminder, POP 101 was for operational support. So this is those basic staff and other functions internally that it just helps shore up the DELC operations. So that's 4.7 million, 14 FTE. And then our birth through literacy, our birth through 5 literacy POP, we had actually requested about 25 million. The total amount that was in the GRB is 12.5 million. So this is 12.5 on top of the 9.5 or 9.4, I can't remember exactly what it was, that we've had for this last biennium. So going into the next biennium, we're going to have close to 20 million just in the birth through 5 literacy plan, plus 2.2 million for Dolly Parton's Imagination Library, and about a quarter or a third of a million to help us update the early learning and kindergarten guidelines. So that's a pretty substantive investment in some very important programming in addition to existing programming. Okay, next slide. And then the last POP that we had was for an increase in childcare licensing staffing, which is about 13 FTE and 3.1 million. And this is really important, especially for our staff, that we have some high caseloads and we want to bring those more in alignment with national best practice. And this will really help us meet those customer service and response times, compliance needs for providers. Okay, next slide. There were some additional investments beyond what we asked for specifically in POPs. One is that we have put forward a legislative concept to create a tribal early learning plan and fund in lieu of the tribal early learning hub. And the governor's budget did include 4.7 million to fund that plan. This will help be funds available to the tribe for things like language revitalization or other things that they see fit as part of that plan that they will be developing. Then there was also $4.3 million investment on top of current investments in early childhood mental health consultation in support of what we're now calling Every Child Belongs, which is our expulsion and suspension prevention program. So there'll be additional resources to help shore up that program as it's being stood up in this next biennium. So these are again additional investments that weren't in our ARB but are in GRB. Right. Next slide. All right, and that is it. Thank you.
Thank you, Joel. Certainly a lot of good news, which is always helpful. I see both Fairbors and Dr. Brown. It looks like you're on, so we'd love to hear from one or both of you.
Good morning, Sue. Good morning, everyone. Thank you for having me. Sorry to be late. I see that my colleagues have covered the budget process, the 1%, Dave's calculation based on his salary, and as it relates to the $50 billion or whatever they have. Yes, so I won't go over those, so my presentation will be shorter, but we do have a slide deck, and I think, let's see. Okay, thank you so much, Gabby, for putting that up. We can go to the next slide, please. So again, I appreciate my colleagues setting the stage, and basically, specifically as it relates to early learning and education, 3 different areas. We start with child welfare, and I share with you, not all of our policy option packages got funded, but I'll share with you what did get funded. So we can go to the next slide, please. So this one is policy option package 111. It is focused on expanding what we call the focus program. This is a small team, very effective. They work diligently every day to keep kids out of temporary lodging, and to the extent possible, keep them at home. And that's where really it relates to other children that are in the home, parents, etc., where it preserves the family dynamics, etc. On a daily basis, they are collectively, again, this is a small team, preventing 75% of the children that could possibly end up in temporary lodging or they need placement. So what this package specifically supports is a couple of things. Specifically, that team does is they're responsible for response whenever that a child does not have a place to go or a placement to land in. They contact the support network, making sure that they can do everything that they can to find the appropriate placement for the child, and then providing support for caregivers, specific caregivers. Currently, that support is being piloted in 9 counties, and what this funding does is that it expands that to all of the counties across Oregon. It supports family preservation, child well-being, placement stability. It helps permanency. It provides training and coaching for caregivers so that they can keep their children in their respective homes, because not only, we are not just talking about the cost, it's very costly to put kids in hotels, temporary lodging, or even residential care facilities. Aside from that, children prefer to be home with their own parents or even in a supportive resource home. And the outcomes that we hope to achieve by this investment is that we hope that this can increase capacity for children's foster home, support children with very complex needs that quite often are the type of children that end up in temporary lodging. It provides enhanced support for providers and ultimately better outcomes for children. As it relates to the impact that this will have on equity, naturally, it also supports caregivers in underserved regions of Oregon, rural counties, etc., and allows access to services and supports so that they can be safely managed in the care environment. You can see these data also have the investments, FTE, and some of the data as well. Next slide, please. The second policy option package for child welfare is basically evidence-based services for community pathways to prevention. This really is focused on a continuation of the implementation of Family First Prevention Act, Family First Prevention Services. You all know about that. Focuses on behavioral health, early childhood, parenting services. The focus of this package, and really the focus of Family First, is to identify the root causes of why children and youth enter foster care system. Does it have anything to do with parents' mental health? Does it have anything to do with substance use? We know that both of those things are true. And also, with this investment, with this general fund investment, we also guarantee a 50% federal match for the program. What we hope to see as a result of this investment is more families can receive services earlier, so they can either avoid children coming into foster care or shorten the experience of the children in foster care. As far as the equity impact, again, we all know that African American children, Native American children, including Alaska Native children, and their families are overrepresented in the foster care system in Oregon. And our hope is that these prevention services will be, and this will be intentional. This is not a hope. This isn't. We will be designing these services with these communities and tribes so that it actually would work for the communities that are most overrepresented in the system. Next slide, please. So this one is to provide a path to housing stability for youth in foster care. You may already know that young people, youth who experience foster care are disproportionately represented in the number of youth that experience homelessness. It's nothing to be proud of. It's a reality that's happening. Some of these youth, some of these young adults are already parents, and without a place to live, they're also putting their own children. We as a system are putting their children at a much higher risk of experiencing foster care. The funding that goes along with this package will support planning to improve youth's housing outcomes as they exit from foster care. It provides funding to raise provider rates, independent living programs. They need additional funds. It also has within that two positions that would be focusing on maximizing SSI, supplemental security income benefits for those in the child welfare system. What we hope to accomplish by this investment is we feel that it's aligned with the State of Oregon Homelessness Response Framework. It also begins to put in place target outcomes and measures for housing programs serving youth exiting foster care. And it also will create a data-informed plan and all of the policies that need to go along with that to increase the housing stability for this population. Next slide, please. We have, and we can go to the next slide. We have one policy option package for Office of Developmental Disability Services, and it's focused on service equity and accessibility. This is specifically focused on the tribes. It's a tribal navigator program that expands language access services and also increases support for community engagement, family networks, and self-advocacy. It also builds infrastructure to support government-to-government relationship with Oregon tribes. You all know that tribes are not just customers, they're not just a partner. We have a legal obligation to them because they are independent government. We have a tribal consultation policy. It's a joint policy with Oregon Health Authority. We are required to meet their needs, consult with them when we're making changes to systems, when we're putting investment packages in place, etc. It also will support the local equity work that's happening by the tribes. It provides coordination between Office of Developmental Disability Services, Office of Equity and Multicultural Services, which is our equity and inclusion and belonging armed within ODHS, an Office of Resilience and Emergency Management. Some of you may have heard of OREM, the part of the organization that focuses on emergency response. We are responsible for not only our own population that we serve in ODHS, 1 in 3 people in Oregon, but every Oregonian as far as disasters and emergencies for food, water, and shelter, including the tribes. So this also focuses on emergency response. It funds the family networks and tribes' own equity improvement work that they're doing. What we hope to accomplish with this package is improve service equity, increase access to IDD services. Those are really hard to come by. Some of our kids, right now we only have really a handful of kids in temp lodging, but quite often those are kids in need of IDD services that's not available in the community. The tribes face the same issues. It also strengthens tribal relationships and hopefully improves customer service as the tribes see and experience our services. As far as the equity impact, it makes sure that tribal individuals, their families, have equitable access to services that they need. Now we go to self-sufficiency programs, and we can go to the next slide. A couple of packages in self-sufficiency. The first one is a job incentive payment increase. You all know about TANF, Temporary Assistance to Needy Families. It's a program that provides monthly cash benefits along with employment-related and other supports to help families with low income or minimal income to meet some of their basic needs. Most of the states struggle to meet, there's a work requirement by the TANF program, and most states struggle to meet the work participation rate that is a requirement for TANF. Some states use what's called a job participation incentive, or JPI, so that they can meet that 50% work participation rate. Feds are now requiring that states to at least pay $35 incentive for that JPI. And that $35 investment actually is very helpful to avoid the penalties that the state would get if they don't meet that work participation rate. So what this package does, it increases the job participation incentives from $10 to $35 per month for qualifying families. It allows them to be included in the work participation rate, which is currently capped at $10. And by doing that, we hope that all of the participants in this program can be counted in our work participation rate. It can enhance our services to them. And as a result, we would avoid any penalties that we have to pay. And as far as the equity impact, it directly addresses disparities by funding initiatives that target the most underrepresented communities and makes sure that all individuals have equitable access to the services that they need. And then finally, the next slide, it's something that I think we all care about, and that's youth experiencing homelessness. And what this package does, it's really investment to help avoid youth homelessness. There are some core elements to this youth experiencing homelessness program, including comprehensive continuum of youth housing and support services, building capacity and providing technical assistance, programs that are actually designed by youth and driven by youth, focusing on successful outcomes for youth and then alignment with other youth serving systems. It extends funding to support young people to help them move toward permanent housing stability. You may remember that there was a House Bill 5019 in the 2023 legislative session that provided a lot of funding for this program. Those funds expire next June, in June of 2025. And we've also seen actually significant growth as far as grant providers. The total number of youth experiencing homelessness program, as far as grants, increased from 13 to 42. The total number of counties with the grant increased from 12 to 26. And the grants themselves went from 24 to 71. So again, it's been a very successful program. Not only will this investment will help youth find housing and would allow them to access a wider range of services and supports that they need with long-term stability, hopefully leading to well-being. And by expanding those services, it also helps us improve our collaboration with local partners. They're already making progress. What is again unique about this program is that youth are helping us design it and deliver it across Oregon. And again, it will make sure that the investment that were made in the last legislative session will not go away, because if we do not, well, you know, it's a governor's recommended package. The legislature still have to approve it, but if they don't approve it, the program funding and the program scope will be reduced by 75%. And from our perspective, this is something that's critical. We need to keep youth safe, housed, etc. And I think the next slide is just a visual for your pleasure. So that's what we got. That's my contribution for today.
All right. Thank you, Fair Boars. Once again, very important programs. And thank you, Dr. Brown, for getting all of that information to us in advance of our meeting. So now I see Dr. Williams is with us. Welcome, Dr. Williams. We appreciate you being here. Good to see you again.
Good morning. Good to see everyone. I just want to share a few highlights about ODE's budget. As some of you may be aware, the governor's office partnered with agencies as well as stakeholders to address the current service level for school districts, which has resulted in a $600 million ask to redefine our current service level. There were three pieces of that particular conversation around the way we distributed the budget that put more dollars in the system, you know, instead of a 50-50 split over the biennium, half the dollars in the first year, half the dollars in the second year, doing a 49-51 split. That is more reflective of the increased cost associated with the second year of the biennium. The second part of the CSL adjustment went to compensation cost calculation. So we used to use a 20-year linear regression, which now has been reduced to 10 years to emphasize the impact of what's happened recently with districts, you know, from COVID and negotiations and all of the various things that are impacting expenses for districts when it comes to salaries. And then the impact of local property tax revenue on that. And so there's been media on that piece, but just kind of reminding this is important and historical because normally what would be happening right now is a back and forth between advocates and agencies and the governor's office around what the current service level dollars really, what the numbers really are. And for the first time, I keep hearing just this is a story that I'm hearing advocates tell, for the first time in, at least a decade. We've been more on the same page with how the current service level number should look. So the overall budget for education is $17.3 million. Again, a number where there's much more agreement because of the work our governor's office and team has just been committed to in terms of our prioritization of education. And to highlight a few more items as far as early literacy, since this is definitely early learning focus, the governor's budget continues our collective focus on early literacy with an additional $100 million ask in school grant funding. This will allow districts to continue to build upon and expand our early literacy efforts and continue to use those allowable expenses that we've already identified. We already have an early literacy framework. We already have the key expenditures that we know will help improve literacy outcomes for our scholars. And so the additional $100 million to support those efforts. This will also help some of our smaller districts that qualify for minimum amount of expenditures. Sometimes I think districts, the floor is around $45,000 or so a year, which, can only make a dent. And so if we add this extra $100 million, it will allow, especially some of our smaller districts, to continue to remain in the program and really see some of the value from participating in this historic investment. We will also ask for an additional $10 million to support tribal and community-based organizations. So continuing to build upon our partnerships. Summer learning, we know that learning doesn't stop with the school year, and we are needing investments year round. And so we have a $75 million ask to expand summer learning opportunities for 25-26 to support academic recovery, social emotional growth, family engagement, so that we can reduce the disparities that our scholars often experience over summer. We are also looking at an evaluation infrastructure so we can continue to evaluate the effectiveness of our summer learning opportunities. So some important work there. Some infrastructure investments, $100 million for capital construction at the Oregon School for the Deaf, ensuring our students have spaces to meet their needs. $185 million for Oregon School capital improvement matching, the awesome grants that really help support districts that are able to raise a portion through their bond efforts. And then we as a state get to match those efforts because we want all of our facilities updated as much as possible. So where the state can come in and support, this is one of those areas where we provide a match. And then $5 million for Connecting Oregon Schools Fund to enhance connectivity, ensure schools have technology infrastructure, which, again, having access to infrastructure, technology, modernized buildings impacts the quality of learning from early learning through 12th grade. We have some modernizing systems dollars in the budget that are important. We're going to update our state school fund architecture to make funding more transparent, predictable, and equitable for districts. We know based on what we see playing out in our media with our school districts that The transparency and clarity around what resources are available is vitally important, how it's being utilized. And so where we can, on the state dollar side, we can't necessarily address what's happening with local dollars, but for sure with our state school fund project, we'll be able to provide communities with that much needed information. We have a $4 million investment in a grant system replacement. Again, just trying to be more efficient so that when we are working with schools and districts, our infrastructure is updated. I hear different estimates. I hear we're 10 years behind with some of our technology infrastructure. Some things are kind of held together with duct tape and Band-Aids. And then, there's just, so I think some of you might be able to relate on the technology side. Another piece for Youth Development Oregon, the governor's recommended budget includes backfilling a critical position for them, ensuring that young people, particularly those transitioning through pivotal stages, can have access to the supports that they need. We continue to ask your support and advocacy in these areas because we know it helps the whole pre-K-12 continuum when there's more money in our system through CSL, the early learning efforts, the summer learning pieces, and obviously the infrastructure pieces to make sure all of that runs well and smoothly for districts.
All right. Thank you, Dr. Williams. I'd say every agency partner has a very aggressive agenda for the upcoming legislative session. And I think the bottom line that I want to convey on behalf of the council is that we intend to be very active in the session coming up. We are actually going to start meeting in person every other month in order to be in Salem during the session. So, and I know with your support staff, we'll be working closely to make sure that we know when your bills are coming up for hearings and know when we can weigh in to support your work to support early childhood and kids and families. And Subin, if it's really quick, because it is just about 12 o'clock.
Yeah, it's quick. I was in a state interagency coordinating council meeting, and we were talking about EIECSE and parts B and C of IDEA. And some family members testified to our group saying they're concerned about the federal administration and their promises to cut the Department of Education at the federal level, which would be catastrophic for IDEA, title funding, Head Start, so many things that we know in the education space. And I'm sure it applies to all the different agency leads here. So I guess my comment and question, and you're more intimately aware than I am, what do we need to do to prepare for such a scenario if federal programs were to kind of disappear in the next year? What might we need to do to kind of pick up things on the state level? I know that's a big question. So thank you.
We have 60 seconds left, Subin. That could be an impossible to answer question. I'm guessing every agency director is being asked to think about that in your own venues, but we really don't have time to go there. As always, we run short on time, especially with you agency directors with us. So I want to thank all of you for joining us. We appreciate the work that you and your staff do every day to support the well-being of kids and families in the state. We look forward to seeing you next month and hope that you have a wonderful holiday season. So thanks for being here.
Thanks so much.
Folks, great to see you. Have a good rest of the day. Good weekend.
Thanks. All right. As always, we run out of time, especially with the agency directors. Okay, council, we now have a 30-minute lunch break, so we will be back at 12:30 get 2 updates on important programs going on, and then we will go into rulemaking and doesn't look like there's anyone who has signed up for the public comments. So we'll just go into rulemaking. And then I'm hoping, and I think I've told each of you this, I'm hoping we'll have maybe 15 minutes at the end of this meeting so that we can sort of debrief the meeting and talk about next steps and just get any feedback you want to provide. So that's it, and we'll see you at 12:30. Thanks, you all.
And just a reminder to make sure that your mic is off. I'll pull a slide up and pause the recording, but just, yeah, reminder for folks. Thank you. So whenever you're ready, Sue, you want to just bring people back and then we can get started.
All right, sounds good. Okay, welcome back, council members, and I hope you all had a relaxing break. It's a lot of exciting information that we've been hearing this morning. Really exciting progress being made. We will have time to talk later about all of the information we got from our agency partners as far as the upcoming legislative session goes. We are obviously going to have a busy session and busy playing our advocacy role. So it will be exciting. So now we're going to have updates from 2 different programs, both of which obviously are super related to early learning. And we're going to start with the Early Learning Transition program. And Lauren Sigmund is here from DELC, and she will give us an update on the very, very close partnership that she and ODE staff have in putting together a exciting and very reinvented early transition program. So Lauren, welcome. Thanks for joining us today.
Thank you. Good afternoon, Chair Miller and members of the council. As introduced, for the record, I'm Lauren Sigmund. I'm a preschool specialist at the Department of Early Learning and Care, and I will be sharing an update around the Early Learning Transition Check-in alongside some close colleagues from the Oregon Department of Ed and some of the members of our team at DELC that are also supporting the work. And Gabby, we can go to the next slide. Thank you so much. So today we're going to go over kind of where we've been in the pilot process of the reimagining of the Oregon Kindergarten Assessment, how it links to other important Oregon initiatives, where we are currently in our pilot process, as well as our data analysis of the information we've gathered through the pilot process, what our next steps are and the vision for moving forward. And we'll also allow a little bit of time, hopefully, for some questions and feedback from you all around the update. So the Early Learning Transition Check-in was a result of the pause of the kindergarten assessment, which occurred in 2020. And during that pause, there was an opportunity to take a look at how the assessment was being implemented and gather feedback around how it was being used in schools and responded to by families and educators. And through that engagement and a new Oregon Advised or ORA was established to create a collaborative effort that was focused in community engagement to co-create and reimagine what the kindergarten assessment could be. So through collaboration between DELC and the Oregon Department of Ed, there was engagement held to respond to what were historical concerns around the implementation timing, the cultural responsiveness, the potential implicit bias, especially around multilingual learners of the previous kindergarten assessment, and also to focus on the shift away from children needing to be ready for kindergarten to enter, and more about how we can prepare and support schools, districts, and communities to support the children that are entering school. So the new design that is currently being piloted, it's the first component of the transition check-in, is the family conversation. So essentially, it's an opportunity for educators to meet with families one-on-one to build connection, foster relationships, and collect information about those families' experiences prior to school. It aims to support an intentional time for educators and these families to have time together and introduce themselves before school starts, taking a more holistic view of children, giving context to the families that are entering the classrooms, and giving them an opportunity to share their lived experiences prior to entering school. And again, shifting that focus off of children's readiness, so less about the child's skills as they enter and more about the family being able to provide the context of what their child knows and is excited about school, and also what they've been able to participate in prior to entering kindergarten. And in the packet, Gabby included a link to a video that is an example of what the family conversation looks like between an educator and a family member, to kind of highlight and share what it would look like in a school setting. So what we learned through the first pilot process is that it was really important that the family conversation is reciprocal, and there's no power dynamic that's inherent that would come like with an interview. So the intent is really for it to be a two-way conversation for families to share with educators and have an open discussion, providing time to listen and learn from each other, and creating a space to build connection and relationships between families and their educators. And the hope is that it is one important component of a supportive transition to kindergarten, certainly not the entire activity that we would hope to see as children enter school and building that connection. And what we really want to make sure that it is not perpetuating is any type of checklist or survey families are asked to be doing, any sort of academic measure at this first initial conversation, anything that would be considered like a quick or shallow surface level data gathering process, or that where there's that power dynamic where it would be teacher or educator led and transactional in any way. So as I mentioned earlier, the family conversation and the transition check-in are in support of several other of our initiatives in Oregon, the Student Success Act being one of those. Of course, DELC's strategic plan and the Literacy Framework and Raise Up Oregon. In the Literacy Framework and Student Success Act, there are components speaking to creating a sense of belonging for families. And so this family conversation provides an intentional time for that to happen at the child's first entrance into school. So essentially their first meeting and their first entry into K-12, creating that space for families to connect with their educator, to build that sense of belonging, to hear about the family, and to build that relationship that's outlined in the Family and Community Partnerships section of the Literacy Framework, and also reiterated across DELC's plan and Raise Up Oregon. And then specifically in Raise Up Oregon 2.0, Objective 16 speaks about the supportive transition to kindergarten. So this family conversation works alongside providing that space to make that happen, and can provide really important information that families share directly about their experiences in accessing program and services prior to their kindergarten year. So here's a highlight of the pilots that have been implemented to date. As I mentioned, it starts with that engagement with families, representing really intentionally diverse perspectives, making sure that we are hearing directly from families who have been historically marginalized by Oregon educational systems in the past. It grew to 9 schools in the next year, and as you can see, has grown almost double each year of the pilot, with really the intention around making sure that districts and schools that participate represent both the size and demographic and geographic variations of districts across Oregon. So making sure that as we're piloting, we're getting the experiences of small and large districts, rural and urban, and also districts that have various or widespread demographics of families and children that are enrolled in them. So our last one in the fall included 50 schools and thanks, Gabby, 50 schools in 15 districts and almost 1,800 responses to the family conversation. So it's been about a year since our group has been here to update you all. So we wanted to kind of highlight some of the improvements and updates that we've made in the pilot process since last winter. And one I really wanted to highlight was we have added in data collection that keeps track of the families regardless of their level of participation. So prior to last year, we didn't collect information on families who didn't participate. We only received information on those that gave permission to share their responses. And so this year we asked educators to keep track of all the families that were enrolled in their kindergarten, if they chose not to participate, if they were unable to connect to be able to participate, and if there is a reason why. Because we found we really want to know if there's themes in the families that are participating, if there are reasons that are barriers to them, whether it's accessing the family conversation or scheduling, or if there's certain demographics that the family conversation is not reaching. So that was an intentional way to gather information on who might be missing still from this conversation. The next slide. Yeah. Thank you. So again, there's a video link in your materials that you can take a look at to see this in action. It really starts much before the start of the year. Districts and schools make scheduling decisions about how to implement the conversation. Training materials are provided to the schools that are participating in the pilot from the Oregon Department of Education that include essentially an assessment manual. They get access to video, so as example script. We provide technical assistance through office hours and support development of resources for families that are translated into the 7 languages most common in Oregon, with the intent that those communication materials are sent out to families using culturally responsive guidelines prior to any of the family conversations taking place. So the families are really aware of what they're going to be asked and what it's going to be like before they come into the school to have those conversations. The intent is that those conversations take place prior to the child's first day in school, so typically in August or September, and the teachers are taking notes throughout that conversation to gather information. Excuse me. And then the data is entered by the end of October and reported back to the state. So again, it's designed to help educators connect and learn about children and families, as well as inform DELC and ODE about their experiences and what programs or services they've had access to or hope to have access to prior to entering kindergarten. And it uses both, oh, sorry, Corinne, this is yours. I'm just keeping going. I'm going to pass it to Corinne, who is one of our colleagues from the Oregon Department of Ed, and she'll share a little bit more about the data collection.
Yeah, thank you. Yeah, so as Lauren was saying, the family conversation includes 2 types of questions to reach our 2 goals. So we use some open-ended questions that allow for families to share their experiences in their own words. So for example, what are your hopes and dreams for your child? We also use some close-ended questions as well, where there are predetermined response options. So for example, families were asked about their service utilization prior to kindergarten, and there was a list of 10 services that they could select from. And then ODE and DELC partnered together to analyze families' responses from the 2023 pilot data year. And data come from over 1,000 check-in conversations across 30 participating schools for that year. And I'm going to go over just some of the preliminary results of that in the next couple slides. So the first set of results I want to highlight relates to our goal of relationship building between teachers, families, and students. So families shared about children's personal strengths, which included things like loving to learn and being excited for school, social skills and development, such as loving to nurture and help others, and strengths related to emotional regulation. So, for example, one family said, "My child has faced significant challenges during the past year and can therefore display strong emotional reactions. However, my child has grown and healed tremendously." And then beyond personal strengths, familial strengths were also mentioned, such as having positive relationships with parents, siblings, and grandparents, as well as the ways in which families valued and fostered their child's connection to culture and identity. Families also shared aspirations for their children. So that included things such as social development, like being a kind friend and learning how to work through differences. It included things like learning in academics, so gaining a strong foundation of all subjects. And there were some more holistic aspirations shared as well, such as blossoming, thriving, and feeling loved at school. And so then this other set of results that I want to focus on relates to our goal about learning about families' experiences prior to kindergarten. And it also is a good example of how closed and open-ended questions really complement one another and offer a more holistic picture of families' experiences. So this figure shows the preliminary findings for a closed-ended question about service utilization prior to kindergarten. So the graph is showing the percent of families that received a particular service, and families could receive more than one service. So the percentages here are going to add up to over 100. And there was also a follow-up open-ended question that asked families about which service they felt was most helpful. And this follow-up provided more nuanced and personalized information. If you could click a couple quotes. I think there's one more. Yeah. So for instance, one family was talking about how preschool helped their child make friends and gain more independence. And then another family was talking about speech services and how that was really helpful for their child to learn about tools that could help him express himself. And then, so our analysis team right now, we're currently in the process of refining the themes and patterns that we're seeing in the data and putting together more detailed results to share in an upcoming full report.
So let me interrupt for a second, Corinne and Lauren. We have 4 minutes left for this presentation. You need to know that the council has seen these slides in our packet, so we are coming into this with some background information. And if there's 1 minute of something you want to really highlight right now, great. Otherwise, I'd like to open it up for council to ask any questions. As always, we are very tight on time. Liz.
Oh, Liz, it's doing the sound issue that we had a couple weeks back.
Liz, you could put the question in the chat.
Are we going to have to rely on the chat for now, Gabby?
I think for Liz's question, I think so. And I'll address that first. Where do early learning providers fit in this effort? And then Subin has his hands up. So I think the sound issue, I think, unfortunately, is just on Liz's end.
Okay, can somebody respond to that? How early learning providers fit into it? It looks pretty kindergarten focused.
Yeah, so as we mentioned on the slide, this is one component of supporting that transition to kindergarten. And so in an effort to help bridge that connection, one of the priorities for our pilot this fall is connecting those partners with their school districts by sharing information on who's participating and being able to share the resources with partners. in the community to help inform families about the family conversation as they enter school. And we've been discussing with our Early Learning Hub partners, as well as at their directors meeting, about what the challenges and successes in community that they've seen around those efforts and how we can help support that moving forward.
Thanks, Lauren. Subin.
Hi, Lauren and all. So the last time we saw each other, we had a robust conversation around what was going on with the family conversations. You've done so much work since then, and what I'm really enjoying about what I'm seeing is that this is pushing the system to be more asset-based, right? I think what we had before with the OKA, and there were many, I guess, valid ideas that went into the OKA, but it was really deficit-based in terms of like how kids were seen by the system and how they were being acknowledged, and it really focused on a limited set of skills. What I think really this hinges on was the part that Corinne was sharing with us, is that analysis, right? What happens with all these themes? What do schools learn as a result of these themes? And more importantly, because what you're saying is the systems need to shift in order to better receive children, what are the actual practices and shifts that need to happen in school? So is that coming from you? Is that coming from regional entities? Or who's coming up with what those practices and ideas are, and and if you're going for that local idea of the ideas come from local regions and entities, how do those ideas get shared between all the different regions? And so I feel like that's a really important thing. And then I just feel like, I don't know if you have this already on your team, but like that research methodology of finding those themes and getting, I think, Lauren, we talked about a coding manual, right? Like how do you code different conversations that people are having? That's going to be critical, because I think people can also do that analysis for themselves in their own regions if they have a coding manual, right? And so those are I have others, but no time.
So do you want to respond to Subin's comments at all, or?
I can do a quick one. Thank you, Subin. Yeah, that currently, and being able to gather that qualitative information is a new skill that we're improving our muscle on, and we have great collaboration with ODE on that. And they have developed a code book for this pilot analysis, but we know as we implement statewide, that's going to be a new challenge to be able to gather those themes across the whole state of entries, around 40,000 respondents. So we are gathering feedback currently around, on a report from the state, what would be most important, and then what levels of community information are most needed and how we can make those accessible. So if you have thoughts or feedback or want to talk more, please feel free to reach out to us afterwards, and we'd love to hear how we can partner in making a report that's really useful at those different levels.
Okay, thanks, Lauren. Lauren, I think my question would be, how are the school districts responding to this? Obviously, they're key. They can make it or break it. And I see one of the needs for implementation is additional funding to support districts. So where's that sit?
That is a great question, and I think I will take it. Hello, everyone. My name is Sodhi Fern, and I'm the kindergarten through second grade balanced assessment specialist at ODE. And I've met many of you before in different different ways. So at this point, we know that the work has to be in pilot process until there are some things that are in place for school districts. We are in these pilots, we have been learning so much about what is possible. And then we're also learning about some barriers that are in place for teachers to do this and do this well, create a welcoming environment for families, and then also thinking about unintentional consequences. So in order to make sure that we align our practices with anti-racist practices, we need to be really careful and intentional about how this rolls out, and that school districts and educators feel supported in the process. They have the materials that they need. They have the resources that they need. They have ways to collaborate with each other. During this last pilot, we worked together and led community of practices, and school districts learned from each other about how to implement this and how to do it well. We are opening up another community of practices coming fall, which will start in February. For 2025, and we just don't know what's going to come out of the legislator session, right? We just don't know. So we're operating on pilot form right now, but we have large school districts now who are coming in and saying we need to be prepared, and this is a gargantuan effort, at all levels for this to be a successful implementation. So we do know that we need to have resources to help with our qualitative analysis and reporting, and then also additional funding for whatever school districts need to, plug in the holes that they have in their engagement process with families. So
thanks
for your
Jody.
questions.
Yeah, thank you. And I think it'd be helpful for us if you can give us any information just in writing about what districts are already engaged and committed, and where's your expansion going from here?
That's wonderful. We actually have a slide somewhere that we can send.
Yes. Okay, thank you. Peter.
In the pilot, did the kindergarten teachers find themselves being asked to connect families with resources in the community? They found that
Yes.
they were kind of being given that task? Okay.
Yes, that was one of the things that we provided guidance around, was like, what other staff, who could you connect with, so that families, when they shared things that they were needing, you could offer that support or that resource and connect them to things that are happening. So, we know families have stated for years that transition into kindergarten is quite abrupt when they've had the supportive early learning experience, right? And so making this learning from early learning partners about what has been really rich and meaningful for families, so that K-12 systems can learn from it and then implement them well.
Great, thank you.
Awesome. Thank you, Sodi. So Lauren and Sodi and Corinne, thank you very much for joining us. Sorry we didn't have a lot of time, but we appreciate the update. And any information you want to continue to kind of feed us through Gabby, please do. You don't have to just wait every year to come back to a council meeting. So thanks for the work you're doing.
Thank you.
And now we're going to turn to Whitney. Whitney, thank you for being with us. Sorry, we're running a little bit late. I've asked just to get a quick update on the Child Care Infrastructure Fund, since we all know about it, we've all heard about it, and we have the slides in front of us, Whitney, as far as the staggering numbers of applicants and money requested, et cetera. So I think our big question is going to be, so where does it go from here, knowing that $10 million was a drop in a huge bucket?
The 300 million requested bucket.
Yeah, that bucket, exactly. Whoa.
Yes. First off, hello, everybody. Whitney O'Connell, the Early Learning Business Support Coordinator at DELC. I am supporting the Child Care Infrastructure Fund program alongside Business Oregon and with our technical assistance providers, First Children's Finance and Northwest Native Chambers. So since we're kind of limited on time and you all have said that you've gone through the first slides, I'm sure you're aware that the first round did $10 million in grants. That was open for 45 days. It was introduced August 15th and then closed September 30th, and grantees have been notified of their awards and they have 10 days to confirm that they're ready to receive their award. If they don't confirm within 10 days, Business Oregon will move down the list of the next highest scoring applicant. So let's go ahead and move on to the next slide so that we can get into the data of the technical assistance that was provided from First Children's Finance and Northwest Native Chambers. So as you can see, there were over 2,000 incoming TA requests. This was by phone and email between both technical assistance providers. Each TA provider served 500 unique individual childcare business owners. and approximately 20% of those TA requests were in Spanish. And with those requests, they spent a minimum of 30 minutes. So that's a lot of technical assistance. Go ahead and move to the next slide, please. So in the first round, there were over 700 applications from 34 out of the 36 counties. Wheeler and Baker were the only counties that Business Oregon did not receive applications from. And as we talked about it, there were over $300 million requested in the first round for funding. I will give a brief just note. 14% of the awardees were Spanish speaking, which I think aligns with House Bill 3005 and the call out to prioritize culturally specific, historically marginalized, and underrepresented communities. And that 53% of those awardees identified as culturally specific. Another thing I want to add in here that is not listed is that 34 out of the 64 applicants that were awarded actually also offered extended care hours to families. I think that's something we really need in our state. So I was really happy to hear that. We can move to the next slide. In this slide, I thought it was important to highlight both the child care resource and referral and early learning hubs that each had applicants in their region, and also to look at the fact that each of these regions were awarded. So every region received an applicant with the CCR&R and the hubs. And what you can also see is that of those over 700 applicants, there is a high demand for childcare business owners requesting infrastructure funds. Next slide, please. So when we look at the data of the counties that received awards for the first round of funding to be given to childcare business owners, you can look and reflect off these numbers, and I hope you can see how intentional the Childcare Infrastructure Fund program was at making sure each county in our state did receive these funds. We all know that childcare business owners operate on razor-thin margins, and to see that in our state, we are striving to reduce administrative and operational costs to providers is encouraging and exciting. And this is the data for only round one. The second round of the Childcare Infrastructure Fund is only aiming to enhance the support that is being given. The Child Care Infrastructure Fund program has been a wonderful asset to our state, and so is ensuring that quality technical assistance will be provided at no cost to childcare business owners. The technical assistance will continue to support childcare business owners that will need to complete documentation to keep their award, support in budgeting and planning and spending, and also grant reporting alongside many other services to support childcare business owners and their business operations. Next slide. Both technical assistance providers will continue to support the Child Care Infrastructure Program, and the new applicants who did not apply in round one and/or those child care business owners who will apply in round two or future application rounds. And I will try to leave some space for questions.
Thank you. I appreciate you going through that very quickly, Whitney. Council members, any quick comments or questions on this information? Business Oregon is obviously a key partner. Someone suggested this morning that we invite them to come to one of our council meetings when we talk about childcare, because infrastructure is so important. Yeah, Marie.
Whitney, thank you so much for sharing what you've shared today. And I'm just wondering if you have any data, or Business Oregon is planning to collect any data, not just around like number of recipients per county, but more about programmatically, you know, number of students served, are the programs still operating? What sort of your scope of information that you plan to do data collection on?
So I'm glad that you asked that question, because our technical assistance providers they also sent out a business survey that will be presented later this month to all childcare business owners in our states to reflect on how many slots they have open currently. And Business Oregon specifically, when we're looking at the application, we're also seeing it as an educational resource tool for childcare business owners. And those right now, I would say we're in the weeds with it for the second round, and happy to take like this feedback back to Business Oregon and our technical assistance providers when we meet. We ask about enrollment, but we don't specifically ask for numbers. But I think what's wonderful is that First Children's Finance is doing that survey. And so happy to report back on those numbers and just pass them along to Gabby so that she can send them all out to you.
That would be great, Whitney. We'd also love a breakdown on infant toddler versus preschool care, because that's another really critical question for us. Marie, did you have one other comment?
I was just going to also ask Whitney if there had been any sort of like lessons learned from round one that would inform round two, and who did you hear from in that process to inform those potential changes?
I think everything is always a learning process, especially with our state doing this for the very first time. So what I will say is that we are continuing to work on a tribal consultation within our tribal affairs here in Delk, because we did see 4 out of the 9 tribes were awarded. They had a 45-day time span, and we know that with tribes, sovereignty is key, and respecting the fact that there's a lot of different communication channels that tribes have to go through. So we would like to explore options in making sure we're being cognizant of everyone that we're serving with these infrastructure funds. Another thing that we've learned is that we can enhance this application to be what I said as an educational tool. So asking providers maybe things that they might not even fully be aware of when it comes to business operations. So things like, are you serving infant and toddlers? The extended care hours, I think, are really key in supporting like workforce development with our families. I think that we learned from some other programs, not to name like specifics, but they just don't know what they don't know. And so this can be a space with marketing the childcare infrastructure funds, as we had over 900 participants in the Delk webinar when this first was going live to our state. And that's a lot of providers attending and wanting to get that information. And happy to bring, sorry, Chair Miller, happy to bring any questions or suggestions that you specifically saw from this first round that you may have heard in your area back to Business Oregon.
Awesome. Thank you for being that liaison. Super, super important part as the council figures out some next steps around the childcare crisis in the state.
Yes.
So good to see you. Thanks for joining us, and we'll look forward to seeing you again.
Thank you very much for having me.
Right. Council, we're now going to move on to rulemaking, and we did receive public comment, which is in our packets. So I just want to comment on that and refer people to that. I want to thank the people who did provide input, and we appreciate you looking at our agendas and making suggestions and asking questions of the council. Some of them are within our purview, some are a little outside of our purview, but we will certainly take them into consideration in future meetings. And as far as the specific suggestions that came in from the AFSCME Local 132 concerning rulemaking, as you know, Council, we are scheduled to adopt rules today after a year-long process of these being developed. And so I've talked with Chris O'Grady, who's our legal affairs manager, and staff will be referring to the comments and suggestions for the rule sets that came in from AFSCME. So they will be responding to those because we need to take action on those rule sets today. So with that, I will turn it over to Chris, and thank you for putting all of this together with lots of staff people.
Yeah, of course. Thank you, Chair Miller, and good afternoon, Early Learning Council members. Again, my name is Chris O'Grady, and I'm the Legal Affairs Manager here at the Department of Early Learning and Care. We will have 3 rule sets for action today for you to vote on, and then we will have a briefing from the Early Learning Hub coordinators on our Early Learning Hub rulemaking process and timeline and engagement. The comments that were made by AFSCME have to do with the family childcare rule set. So the CCLD team will be addressing the public comments that were made and how we have amended or not amended our rule sets in response to those comments. And then I'm going to turn it over now to the CCLD team to do the overview on the family childcare rule revision.
Hey. Okay, thank you, Gabby. Okay. Good afternoon, Chair Miller and fellow council members. My name is Abby Strom, and I'm a policy analyst with the Child Care Licensing Division. And today will be our final presentation on the Registered and Certified Family Rule Revision as we present rules for adoption. We will briefly cover the Rulemaking Advisory Committee, public comment and testimony, as Chris mentioned, and then our responses to these final engagement activities. Next slide. Oh, I guess I got a lot of slides in there. Just as a reminder, these are our guiding principles for rulemaking that have been consistent across all of our license types. And we have completed extensive engagement with childcare providers, other state agencies, and subject matter experts throughout the development of rules for family childcare providers. We really try to keep our guiding principles at the forefront of our thinking as we made amendments in response to ongoing public feedback. Next slide. This is our rulemaking timeline and engagement milestones. This slide reflects the work that has been done in 2024 in regards to engagement and rulemaking for family childcare. But as a reminder, we really began this revision process prior to the pandemic with the development of several drafts and then also some additional engagement, and then was put on hold prior or during the pandemic, and then we have picked it back up here in 2024. Next slide. So we have held a rulemaking advisory committee in September and October with 4 RAC meetings. The full rule text for both types of care were reviewed by participants. Engagement was quite high with participants attending most meetings. CCLD also offered RAC participants the option to submit additional feedback through an online feedback form. 15 participants were selected to be on the RAC, including both certified family and registered family providers, families of children in this type of care, community partners such as individuals from Child Care Resource and Referral, and also Early Learning Hub representation. There was also statewide representation as providers came or represented Eastern, Coastal, and Central Oregon, as well as urban areas of the state. And we also had both Spanish and English speaking providers. So just to give some general feedback that we received from the RAC participants, there was an appreciation for the alignment of foundational health and safety standards across both registered and certified family, as well as across all license types. So really reflecting back to one of our guiding principles, which is really to align foundational health and safety standards across license types. Feedback was positive around the removal of group size requirements. This is specific within certified family, which we presented on back in September, as well as the second toilet requirement in certified family, which we also focused on in September. So now certified family childcare providers only need 1 toilet in the home to serve a maximum of 16 children. And we also did remove references in specific situations to zoning, planning, and building codes. There was an appreciated for added flexibility to allow renters to live on the property while meeting specific requirements. And participants appreciated that recommendations that were made in previous engagement sessions, such as our online feedback form, our listening sessions, and then the work group, were really reflected in the draft that was presented at the RAC. Before I move on to changes we made based on RAC feedback, I'm going to invite Alicia Gardner to speak a little bit more to this.
Welcome,
Good afternoon.
Lisa.
Thank
Good
you.
to see you
Hi.
again. Hi.
Good afternoon, Chair Miller and members of the council. I'm Alicia Gardner. I'm the Child Care Licensing Division Director. It's nice to see you all again. And wanted to just provide some clarification and context related to the planning, zoning, and building code requirements. As some of you may know, there is a work group that has concluded as a result of House Bill 2727. The work group was run by DLCD, and there is a legislative report due out very soon on the results of that work group. Here to note that while there was a note in that report related to the toileting requirements, CCLD had already noted that we were going to remove this requirement. So the recommendations coming from that work group folded in nicely with what we had in the works. Additionally, just a little more context on the planning, zoning, and building codes. CCLD is proposing this change to streamline licensing for certified family child care providers in particular, currently for providers, more specifically for providers who do not live in the home. Current CCLD process and in rule states that when a family child care provider does not live in the home, they have to receive verification from local planning, zoning, and building codes prior to CCLD issuing a license. This is not congruent with planning, zoning, and building code requirements. There actually is no relation to what local level jurisdictions require related to the residency of somebody's home or not. So this is a longstanding practice in CCLD that we intend to clean up with this rule set by repealing that rule related to when a provider lives in the home or and really defer the jurisdiction of planning, zoning, and building code issues back to the local level jurisdictions who own the requirements for those rules, laws, regulations, and ordinances. In doing that, that allows CCLD staff to focus on child health and safety, which is our legislative charge, and then hopefully avoiding any inconsistencies that may be communicated from CCLD rather than referring back to the local level in removing this regulation. But we'll note those regulations still exist at the local level and will be deferred to the local level to regulate those regulations. And so what I will say for the council is that report should be out very soon. If you are all interested in these challenges, I think the report does a really good job in laying out different scenarios and challenges that childcare providers have faced within dealing with these sets of regulations, and can't provide much more detail on that for now, but we'll say that there is a report coming soon. I'll pass it back to you, Abby, unless if there's questions.
No, let me just comment. I'm sure that the council will be interested in that report, Alicia. So Gabby, if you could just make a note when that is out to send it to us, and then we'll figure out how we want to incorporate that potentially in a future council meeting. So thanks, Alicia. And I know you've been a key player in that task force. So thanks for the hours you've spent at those meetings. Okay, back to you, Abby.
All right. Thank you, Sue. Thank you, Alicia. So now we're going to move into some changes that we made based on RAC feedback. Specifically, I want to focus on that we made modifications to assistant, which or support staff within certified family, the requirements that allow an individual to substitute for the provider. There used to be a 60-hour requirement of working specifically in the home, and we removed that. We balanced that by adding some additional requirements for orientation for that individual so that they're better prepared to serve the children in care. But that 60-hour requirement was really reported to us as being a barrier for folks accessing the child care substitute of Oregon, that substitute pool that exists, as well as certified family child care providers really tend to share staff if they're in the same community and substitute for each other. And so by removing that, it really kind of opened up the work pool and substitute sharing for certified family providers. And this also was something that specifically we heard from more rural childcare providers, was that that 60-hour was really a restriction and a barrier for them to access the substitute pool. We also clarified sleep equipment regulations. During the RAC, it was brought up that this was an unintended fiscal impact of potentially having to buy new sleep equipment. So we modified the language in both certified family and registered family to hopefully mitigate that cost. And then finally, we aligned the language for infant feeding between certified family and registered family. There were slight differences between the two, and the RAC participants really identified this as being a foundational health and safety standard. And so we did align the language that, and the only change happened in registered family because we used the certified family rule language. Okay. We also made additional changes to clarify rules and remove some rules that were conflicting, and then anything that was found to be redundant. So, and thank you, Gabby. So we did receive one piece of public comment. The public comment period was open for 2 months. And this was really in relation to the definition of older toddler. The piece of feedback was that they would like to modify the age group to include children 18 months. Currently, older toddlers are between 24 months and 36 months. And where we would see this as an impact to some staff to child ratios and group sizes within certified family child care. We are choosing to not make a change at this time. Our staff to child ratios and group sizes are closely aligned with national averages and best practice. And these guidelines are really research-based and designed to support the health, safety, and the health and safety of children. We hosted 2 public hearings, one for certified family and one for registered family. There were no public comments received during those hearings. And then, though not on this slide, we did want to speak to the testimony we received from AFSCME. There were 3 recommendations related to registered family and certified family rule revision. The first recommendation was to add a definition of child with special needs. And at this time, DELC is not adding a definition of child with special needs. Additional research would be needed prior to establishing a definition and the possible impacts of that. Adding this definition will create misalignment across license types, and when there is already a statutory requirement that applies to all license types in regards to child with special needs. The second recommendation relates to when a rule applies when children are in care. DELC, in response, will be adding the word childcare in front of children, and this is specific to Chapter 414-360-0840, sorry, very specific, which is, it's only in certified family, which will identify that this rule is required when childcare children are present, not just any child, but when childcare children are present. And then this same exact rule actually exists in registered family, and in registered family, it does have childcare in front of children. So no changes were needed within that rule set. Finally, the third recommendation relates to a written plan of care when it's required for a child who needs a modified level of care. And in current rule that exists now, a plan of care is required for any child that would need care above what is considered typical. As drafted, this rule adds clarity to what specific elements must be in that plan of care. DELC does recognize, though, that not every child would need all the elements that are listed under this particular rule. So we have proposed to modify the lead into the rule to reflect that only elements that are applicable to that specific child are required to be in that plan of care. So for example, if a child did not have a diagnosed disability, that would not be required to be in the plan of care, but other elements that are applicable to that child would be. And then this change was made in both registered family and certified family rule sets. Okay, next slide. Even though the rules are proposed for adoption today, the effective date will not be until July 1 of 2025. We understand that this is a huge lift for providers and our staff. And so we plan to use that time to really develop supports for implementation, both for our child care licensing division staff, as well as for providers. So we will be translating the rules for both rule sets. We'll be updating and developing new guidance documents. And then we will also be developing templates for new policies, because there are a lot of new policies for folks to create. We'll be hosting provider information sessions, as well as doing an online video series for registered family and certified family that will really highlight the changes, and those will also be done in multiple languages. And I believe that is the end.
Wow. Thank you, Abby. And I think we all appreciate the very rapid response to the testimony that we received from our two AFSCME and the provider who provided input. Are there questions of staff on either the certified family or the registered family rule sets? Any questions, on the amendments that are going to be incorporated in the motion? Katie.
I find it a little disturbing that nobody commented on some of this stuff. And I think this is fairly indicative of rulemaking as a rule, but I don't know what was done to get the word out. And even if you did, how people would find the time to come and comment. And I just want to say out loud that it's really important that we go above and beyond to actually engage folks on rulemaking like this. I hear from time to time barriers that providers are running into, and they just don't have the time to follow what it is that we're doing. And I have this conversation with many other departments about many other things that I work on in my organization. And whatever we can do to make this information digestible, accessible, and reach out more to get comments would make me feel better.
Alicia or Abby, do you want to give a little more background information on the engagement and outreach that you did over the last year?
Absolutely, yeah. And I wonder if it would be helpful to go back to the slide for timeline, just to kind of give a little more in-depth overview of the engagement work that we did do. Gabby, I don't know if you could pull up the slide again for us. Thank you so much. So just to kind of dive in a little bit more, we did approach engagement multiple different strategies in different ways, some of which were intended to outreach to providers who we recognize have very little time in their busy days of caring for children, which is part of why not only did we do intentional outreach for inviting providers in their off hours when they are not caring for children for listening sessions where we had small group discussions with providers across the state, but we also developed what was called an online feedback form where providers could submit what was most important to them to tell us about the rules and what they wanted changed and why through the web. And so in doing this, our hope was is exactly what you named, Katie, was to get feedback in ways that providers have time to give us feedback for. And we did see that tool utilized. In addition, we had monthly meetings with AFSCME childcare providers together, which is not captured on this timeline, but we did that intentionally so we could, because they are representative of the family childcare providers, they often are speaking to providers in ways that we are not. So we were able to hear from them using their lens on what they identify the barriers are in speaking with them. And then, of course, not captured on this timeline, we've been working on this rule set for a very long time. And internally, we speak to childcare providers every single day in our work. And so, you know, in working on this, you know, we knew setting out one of our main guiding principles was to hear what are the barriers for operation. We know childcare is in crisis in terms of supply and operations, razor thin margins, as I heard prior speakers say. And so really our intent was to hear from providers just what specifically is causing a barrier, and then screen, of course, for health and safety to ensure that we can meet intents in different ways related to ensuring that we're still meeting our initial charge, which is to ensure that children are safe in childcare. But wanted to provide that additional context in relation to your comment, Katie, and certainly will also name that childcare licensing in the rules are not this is not the final conversation, right? And so we'll also note that we are often looking for ways to innovate and listen to childcare providers further to understand what their needs are in the moment.
And Sue, I'm not sure if you can see hands, but I know Chris wants to jump in, and then Liz and Marie both have their hands up as well.
Yeah, thanks. I can see those. So Chris, do you want to talk about this before we, yes, go ahead.
I just want to jump in and clarify because I think the public comment report that is part of the Early Learning Council packet shows that there is only one formal public comment. This is not inclusive of all of the work group feedback that we received. It's not inclusive of the listening session feedback received, and even the informal process of feedback that we received through our online portal and submission form. Our public comment form right now is really limited to those legally required public engagement feedback from the Secretary of State, like through our rulemaking advisory committee, through our public hearing, and through the formal public comment period after the notice of proposed rulemaking is released. So this makes me think, as we move forward, how can I more broadly be inclusive of all the types of feedback and engagement that we're receiving and reflect that on our public comment report in addition to what's required to the Secretary of State?
Thanks, Chris. Good point. That would help. Good question, Katie. And I think it was good to get clarification from Alicia and from Chris. Yes, Liz and then Marie.
Okay, I'm hoping my audio will work now. I'm using my phone instead. I just want to have, this is just kind of a general observation that I just want to throw out to the staff. Like, I'm very supportive of the rule sets. I'll be voting for them. I always appreciate the effort that you guys are taking to get that feedback from providers and then trying to adjust the rules to meet them where they are. And yet, when I still look at the regulatory framework that we have for all these various sets of licenses, it still seems very, maybe overly so complex. I just was curious, and so I took a look at some of our neighbors and how many rule sets they are using to oversee their sort of landscape of childcare providers. And a lot of them are able to do, for instance, one set for home-based and one set for childcare providers. And some of our neighbors even just have one rule set that covers the whole gamut. I would just suggest that as we're trying to simplify things, like I think there's some opportunities to try to do
more of that condensing. And because what I hear is that there's a lot of checking in between rule sets to make sure that they're matching each other. And I assume that there's a lot of work that goes into actually making sure that the rule sets are complying with each other. And if you just had them under one, maybe that work isn't so complicated. And the other thing I would just point out related to that is I love the 60-hour thing that you're changing. There's a similar rule set in our certified childcare centers as well. There's an 80-hour requirement that I'm assuming is creating the same roadblock. And so I would hope that that could be flagged as something that you guys may want to look at and bring back a revised rule on that. If that was a barrier for home base, I am sure it's probably a barrier for centers as well.
Alicia, do you want to make any comments?
Yeah, Liz, I will say that CCLD completely agrees that one rule set, it makes a lot more sense in terms of the workload, in terms of being clear. And so we do have general rules for all childcare facilities already established. The council voted on that, I think, was it last year? It was not in the not so recent past. In the recent past, but we do intend after this major lift of revising all the childcare rules, making sure that they are aligned. Any future revisions will be considered. Do they move to the general rules for all as we work on them? And in that way, you know, if the rules do apply to every single facility, why have them written down 4 times, 5 times? And so we agree that that is the way to look at things. So if you, we may be bringing rules for general rules for all facilities in the future to the council for vote. Based on you're absolutely right. Many other states have this model, and it certainly makes things a little bit easier in tracking and understanding. Secondly, I will say that we did do a very similar engagement process with center directors and center owners, as well as staff, in understanding the barriers for staffing models for them. Those rules took effect. I believe the vote was last year at ELC, where we did do a very similar process in looking through the qualifications and understanding the barriers. But of course, we know there is always more conversation to be had, and we love engaging with the providers that we serve with these rules. And so we'll definitely take your feedback